Hello, welcome to the training for the Qualified Hospital Presumptive Eligibility Program. My name is Kanita Sneed and I will be your trainer for this particular program. Today we're going to talk about the Hospital Presumptive Eligibility Program, and we're going to talk about the policies and procedures that you would need to use in order to make PE determinations correctly at your particular hospitals. This is a recorded training with no audience, so you still will be able to ask your questions that you have while you're reviewing the training. Go through and write down any questions that you have on the document that was provided to you in your training material, and it is called Hospital Presumptive Eligibility Training Questions. So while you're reviewing this training, if you have any questions, you can write those questions down. And after the training, you will be able to have the opportunity to send those questions in so you can get responses back to those questions. So again, this training today is going to go over the policies and procedures for the Hospital Presumptive Eligibility Program for you all to do PE determinations correctly. So we're going to go ahead and get started. Our mission at the Department of Community Health, we're trying to provide access to affordable quality health care to Georgians through effective planning, purchasing, and oversight. And then, of course, our purpose at the Department of Community Health is we're shaping the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities we serve. Like I said, this is the training over the policies and procedures for the Hospital Presumptive Eligibility Program. As a participant, you're going to understand the definition and description of what hospital presumptive eligibility is, and just know that PE stands for presumptive eligibility. You're going to look at the requirements and the responsibilities. So as participating in this program, there are requirements and responsibility that you must make sure that you understand and adhere to. We're going to look at the requirements for this program. What does it take for someone to be eligible for this program? So we're going to look at the program, eligibility, and procedure requirements. With this program, you are going to be determining someone's eligibility based off for some aid categories. So as you know, this program it first came about way back in like 1996 when the health department started making presumptive eligibility determinations for just pregnant women. Well, now because of the Affordable Care Act that former President Obama signed into law, and now allowed the hospitals to start making presumptive eligibility determinations. And you're not going to be only making it for pregnant women, you're going to be making it for other aid categories, and we will look at those. We're going to look at how to enter this information onto gametes, because you're going to find out that everything is going to have to be done manually on paper first. And then once you do it on paper and you approve them, then that eligibility information will need to be put into the gametes web portal. Part of this program, you will have to make sure that you are adhering to performance standards. So each hospitals that are participating in this program will have to meet performance standards, and we will talk about that. We're going to look at what references to use if you need it. And then also, if you are a new employee that is reviewing this training for the first time or taking this training for the first time to become certified in this program, you will have to take an assessment after completing reviewing this training, and you will need to pass with the 80% or higher and complete all other required paperwork before you are eligible to start making PE determinations. So we're going to go ahead and get started. So what is hospital presumptive eligibility? So like I was telling you just a few minutes ago, President Obama signed the Affordable Care Act into law that allowed hospitals to start making presumptive eligibility. So that is what this training is going to be about. So as a qualified hospital, you should already be participating as a Georgia medical assistance provider, and that you wanted to start making PE determinations. So you notified us, and that's why you're reviewing this training. Agree to make PE determinations consistent with the policies and procedures that you're going to be provided with today. And then also when an applicant is applying for presumptive eligibility with you all, they will also have the option to apply for full Medicaid and fill out that application, and that will be sent over to DFACS for them to make a determination for full Medicaid, and we're going to talk about that. And one that has not already been disqualified by the department. So what is presumptive eligibility? This is just an expedited way of how we're trying to get people enrolled into the Georgia Medicaid program, and also giving them another avenue to apply for Medicaid without having to go directly to DFACS. So this is what this program is about. It's about enrolling people that are eligible for Medicaid based off of the 8 categories that you're going to make determinations for, and to get them enrolled into this program, and also to give them another avenue to apply for full Medicaid. For their eligibility, this is what we're going to be looking at in order to determine if they're going to be eligible. So everything that they have to meet, they're going to have their income is going to have to be at or below the income limit, and we're going to look at MAGI-based income. And MAGI stands for Modified Adjusted Gross Income, and MAGI just means that income is taxable income. Now, there's some income that we count that is not taxable, like some Social Security benefits. Not all Social Security benefits are taxable, but we do count Social Security benefits, so you will find that out. But again, MAGI stands for Modified Adjusted Gross Income. We're going to look at tax filer status. So there is a specific question that you will be asking all of your applicants, and based off of the answer to that question, that would determine if they will be a tax filer household or a non-tax filer household. And then we're going to go through the budget group flow chart, because that would determine who should be in the budget group for that particular applicant. Going to look at the household size. Of course, they have to be a U.S. citizen or a qualified immigrant, and we will go through the policy to determine how you would determine if someone is a qualified immigrant. And then, of course, they have to be a resident of Georgia. Doesn't matter how long they've been here, as long as they can state that they, intend to stay here and intend to live in Georgia, they are considered a Georgia resident. So just for an example, someone can just have moved here and come in and apply with you the same day. So as long as they state that they intend to stay and live in Georgia, they're considered a Georgia resident. First thing we're going to talk about is how long does someone, once they are approved, how long are they covered up on the presumptive eligibility? So that's what we're going to talk about, what is called their PE period. So the PE period is always going to start on the date that they apply and get approved with you. And then it's going to end the next month, at the end of the month. So for an example, at the bottom of the slide 6, if an applicant comes in and applies at your office on January 31st, 2021, and you approve that person, then their PE period would be January 31st, 2021 through February 28th, 2021. So it always starts on the date that they apply and get approved with you, and it ends the next month at the end of the month. So if someone came in your office and applied on March 1st, 2021, was approved, the PE period will be March 1st, 2021 through April 30th, 2021. So it always starts on the date that they apply. And presumptive eligibility does not revert back to the first of the month like full Medicaid would. So if they come in anytime, if they come in any time of the month, if they are approved for full Medicaid by DFACS, it's going to go back to the first of the month. Well, presumptive eligibility is not like that. It's always going to start on the date that they actually apply and get approved. So remember the PE period, because that will be part of the assessment. And when it asks you for the PE period, make sure you're given the start date through the end date. So now we're going to look at the requirements and the responsibility for you all that are participating in this program. Notify DCH of your interest in this program, which you already have done. Sign the memorandum of understanding agreement. You all don't have to worry about that because if nobody is doing it at your particular hospital now, that's probably because people have gone away, have left or whatever, and now you're coming on, or either you may already have some colleagues that are already doing the program at your particular hospital. So the MOU has to be signed up front with the particular hospital and the department before we are able to let anybody start doing it. So the memorandum of understanding for you all, it's probably already has been done, so you don't have to worry about that. Make correct PE medical assistance determination. So you're going to receive everything that you need today, all the policies and procedures. We're going to go over all of the forms and, just a step-by-step of what you need to do in your interview process. And one thing that you will have to sign is a provider agreement, and that was provided to you in your training material email. So you need to look for the document called Qualified Hospital Provider Agreement. It is 2 pages. So you will need to put your name on the first page and the name of your hospital. You're going to need to read the statements to make sure that you understand and agree to them, and then you will sign and date at the bottom on the first page. And then on the second page, you're going to print your name again, put your provider ID number, and then there is a chart on that page that lists all the training materials that you should have received. If you did receive all the training material, please initial beside each one of those, and then you need to sign at the bottom and date it. And then also you will need to provide that to your PE coordinator, so your PE coordinator can sign off on it and date it as well. So remember to do both pages. Don't just do one page, do both pages. And you'll learn at the end of this presentation how you will send that information back. But there is a provider agreement that each individual that is being certified for this program will have to sign and agree to. Maintain a list of authorized personnel. This is for PE coordinators only, so they should be maintaining a list of, who's all doing PE determinations at their hospital. And if somebody, leaves, then that person needs to be removed from the list. And then if somebody new comes on and gets certified, then that person will need to be added to the list. Complete the PE training and any additional training if needed. So this is the first initial training that you have to come through. So once you have completed reviewing this training, remember I told you will have to take an assessment and pass with the 80% or higher. And once you've done that, the only other additional training that we usually have is a refresher trainer each year. And that refresher trainer will be, like we're doing now, but usually it's like a live session that we do, and you'll be able to, ask any questions that you have, and we basically just go over, any types of policy clarification that needs to be given to you, any new policy that needs to be given to you, anything that has changed with procedural wise, or areas that I see that most people are making the mistakes in, we go over that. So it's just an opportunity for us to refresh up on a program, especially if you don't do applications that much. So it's just a time for us to refresh up on the process and making sure you understand the policies, and also for you to ask any questions that you have. There can be additional training if I feel that that particular person or that particular hospital needs it, because if I feel they're making, a lot of mistakes and I've brought it to your attention a few times, then I can require that you do additional training. But as of right now, it's just one refresher training that everybody, completes each year. Cooperate with PE monitoring, quality control, and meet performance standards. So there will be audits that will be completed on each hospital that do applications for each particular month. So you will have to make sure that you are, cooperating with the quality control of that. And then also at the end of each year, each hospital is required to meet a certain accuracy rate, and we're going to talk about that later on. Develop a corrective action plan. If we see that you all are doing something incorrectly, of course, we will bring that information or those findings to your attention, meet with you about it, If we feel that a corrective action plan is needed, that's when that comes into play. And then the last bullet is cannot delegate the authority to determine presumptive eligibility to another entity. This is a federal regulation, and what this is saying that the qualified hospital cannot allow a third party contractor to make presumptive eligibility determinations. So if you work at a hospital, you have to make sure that you're the hospital employee. That means you're paid by the hospital in order to make PE determinations. If you work in the hospital but are actually working for the third party company or the third party contractor, you're not able to make PE determinations, okay? So we just want to make sure that everybody understands that you have to be an actual hospital employee to make PE determinations. How will you be disqualified as a hospital? If you're not capable of making PE determinations consistent with the policies and procedures that you received today. So I'm saying everything that you need to know will be in this training today. If you don't understand something, you always have the opportunity to ask any questions that you have. If you're not able to meet DCH's standard, and then once we bring these findings to your attention, we just, provide you with additional training. After we provided additional training, or either we've exhausted all other types of measures, then you would be, disqualified from doing this program. So now we're going to get into our program requirements. We're going to look at the aid categories that you're going to be making PE determinations for. We're going to look at how often someone can apply for this program. We're going to look at how to enter information into GAMIS, and then also look at all of the application and other forms that you would need to enroll an individual or individuals into this program. So the first thing we're going to do is going to look at the 4 aid categories that you're going to be making PE determinations for. So like I was saying earlier, you're not only going to be doing it just for pregnant women, but there are other 3 aid categories that you're going to be making PE determinations for, and we're going to go through each one of those. So the first one is your parent caretaker with children under the age of 19, and it's coverage for parents or caretakers with at least one qualifying child. That means that they have to have a child under the age of 19, and at the time of application, they are applying for them and the child. Now, there is an exception to this if a person is a parent or a caretaker is applying and has children, but the child is already receiving Medicaid, then yes, you can look at that parent or that caretaker for parent caretaker with children for Medicaid, since the child is already receiving Medicaid. So that'll be the only instance. But other than that, you will have to approve the parent or the caretaker with the children at the time of application. You cannot prove the parent or the caretaker without the children unless one of the children are already receiving Medicaid at the time of application. And when we go through in a few minutes, you're going to see that the first thing you're going to do before you do an application on anybody, you first have to do like an eligibility check in the GAMIS system to actually see if that individual is already receiving Medicaid or not, and then to also get their ID number if they were known to the system. So the parent caretaker with children under age 19 aid category is for parents or caretaker with at least one qualifying child. And then they have to meet the eligibility criteria, which I was telling you earlier about the tax filer status. They're either going to be a tax filer household or a non-tax filer household. And based off of that, that will let you know who should be in the budget group, and who's ever in that particular applicant's budget group have to be listed on the application along with their income. Exceptions per the Affordable Care Act, that just goes along with the tax filer, non-tax filer status, because when you see later on the budget group flow chart, if an individual is a tax dependent, we will have to see if that tax dependent meets some exceptions. And there are 3 exceptions that we're going to look at. Of course, they have to meet the income limit, have to be a Georgia resident, have to be a U.S. citizen, or a qualified immigrant. So those are the eligibility criteria that they must meet in order to be eligible for the parent caretaker with children under the age of 19 aid category. Next one is children under 19 years of age. So if you have children that are under the age of 19, then they will qualify for this particular aid category. And the eligibility criteria is the same as the parent caretaker. Have to have a tax filer, non-tax filer status. And then if they are a tax dependent, see if they meet an exception. Income has to be at or below the income limit. Have to be a Georgia resident and have to be a U.S. citizen or a qualified immigrant. Again, that's for the children under the age of 19. The next aid category is your pregnant women, and it's really self-explanatory. So it's just coverage for women that are pregnant. They cannot be in their postpartum period. They have to be pregnant at the time of application. So their eligibility criteria is the same as what we've just went over about the tax filer, non-tax filer status, exceptions, the income meeting the income limit, have to be a Georgia resident, U.S. citizen, or a qualified immigrant. And then the only other extra eligibility criteria is that they must be pregnant. We do not have to medically verify that. They just tell us their state. We just take their statement. And they can only be approved for presumptive once per pregnancy. So it has to be a new pregnancy each time she's trying to apply again. So she can't apply and get approved and it's the same pregnancy, and let's say the presumptive ended and she's coming back to apply again because she's saying her coverage ended. So if that's the same pregnancy, she cannot have another P determination made. It has to be a new pregnancy. And then the last aid category is your former foster care aid category. And these are for individuals who were in foster care, but they age out of foster care at the age of 18 or older. They have not reached their 26th birthday yet, meaning they're not 26 yet. And it is not only limited to Georgia. So if they were in foster care in California, Texas, New York, it doesn't matter as long as they meet these other criteria. And for them, we don't look at any income or resource for them. Well, for anybody for family Medicaid, we don't look at resources, but we definitely don't look at income for these individuals. Their income is basically always going to be zero. So we don't look at any income for them. And they're always going to be in their budget group by themselves. So they're not going to be in a budget group with anybody else. They're always going to be in a budget group by themselves. So if they have other individuals in their household that is trying to get presumptive eligibility determination as well, then we're going to do a separate budget group for them. But for this particular aid category, they're always going to be in a budget group by themselves. And the other family members will be considered for another type of aid category. So again, you have your parent caretaker with children under the age of 19. And remember, the parent or the caretaker and at least one qualifying child have to be eligible together at the time of application. The only exception to the parent or the caretaker being eligible without the child is that the child is already receiving Medicaid. And then you have your children under the age of 19. You have your pregnant women, and then you have your former foster care. And remember, former foster care, they just had to age out of the foster care at the age of 18 or older, have not reached their 26th birthday, and they could have been in foster care in any state. And remember, we don't count income for them, and they're always in a budget group by themselves as a budget group of one. And later on, when we look at the income limit chart, you will see that the form of foster care is not listed on the income limit chart. So that'll tell you right there that we don't look at income for them. So how often can someone apply for this program? So for pregnant women, remember it's once per pregnancy. So it has to be a different pregnancy if she's trying to apply for presumptive again. And then your other aid categories, your parent caretaker, your children under 19, and your former foster care is once every 2 years. So if someone comes in and apply on March 1st, 2021, remember their PE period would be from March 1st, 2021 through April 30th, 2021. So that means that they cannot come back and apply for presumptive until May 1st, 2023. So it has to be a period of 2 years. Now, if you ask the applicant, if they've already had if they've already been on presumptive before, got approved, some may be honest and some may not be honest. And really, you're not really going to know until you've done the application and all of that and made a determination that they were approved. And if you say that they were approved, then we're going to look and see that you're going to have to put this information on the GAMIS web portal. And when you go through the process of entering this information on the GAMIS web portal, if they've had coverage within those 2 years, then you would get an error message letting you know that, and GAMIS will not let you go any farther of adding that individual to the GAMIS system. So at that moment, that's when you will actually give them a denial notice, because you will let them know that you've already had coverage and you cannot come back for 2 years. So that's really the only way either the client telling you or you going through the whole process and then afterwards you're trying to enter them into GAMIS. Okay, incarcerated individual, this is just stating that individuals that are still incarcerated, if they are trying to apply for this program, they are not eligible while they're still incarcerated. So they will have to wait until they are released in order to apply for this program. So if that's the case, then you will not complete a PE applications for these particular individuals. So what does PE cover? Presumptive eligibility covers everything that full aid category would cover. So for instance, if someone was approved for parent caretaker, everything that they would receive up on the full Medicaid, they're going to receive up on the presumptive for that particular aid category. The only difference is for our pregnant women. The only thing they're going to PE is going to cover is for their prenatal care and their pharmacy services. So it doesn't pay for inpatient hospital or labor and delivery services for the pregnant women. Okay, so just note that part of it. But everything else that aid category pays for your parent caretaker, your children under 19 in form of foster care, whatever that aid category is supposed to pay for, that's what it's going to pay for. And for your pregnant women, it's only going to do your prenatal care and the pharmacy services. So once someone has been approved for this program, they are able to go and get the medical services that they need, that same day, if they need to. The only thing is about their prescriptions filled. So if they're trying to get prescriptions filled, you're going to have to let them know once they have been approved that it will take at least 24 to 48 hours before they're able to go get any prescriptions filled. And that is because our pharmacy benefit manager is Optima. So once you enter the information on the GAMIS web portal, that information then has to be transferred over to the Optima system, and that takes at least 24 to 48 hours. So like I said, once they have been approved, you let them know that. Then if the particular individual lets you know, I'm sorry, but this is really an emergency. Can you please do something? Like, I really cannot go without my meds. I really need my medication today. Then in those situations, what you would do is to send an email to the PE Corrections email address that is listed here on this slide. And you would give us the member's name and number, the member's name and the ID number. And in the subject line, you can just put pharmacy update. And then we will go in and go into the Optima system and update that information so they will be able to get their prescriptions filled that day. Okay. So otherwise, please let everybody that is approved know that it would take at least 24 to 48 hours before they're able to go get prescriptions filled. For our pregnant women, they will have an opportunity to get dental services. So if they are in need of dental services, what you would need to do is to provide them with a copy of this form called the DMA 635. and it's called attestation of pregnancy. Once you have provided them with a copy of this, they will need to take this form and get it completed by their doctor. Once their doctor has completed it, they would take the completed signed form to their dentist for them to be able to get the services that is allowed for dental. So again, this is for your pregnant women, and the dental coverage will actually stop on the date that they give birth. So once they give birth, then they will no longer have that dental service. Okay, so the first thing, remember I said earlier, the first thing you would do before you make a PE do anything or make a PE application on anybody, you're going to make an eligibility check or either screen that particular individual into gametes to see if they are currently active on Medicaid or not. Based off of what gametes tells you, that will let you know if you're able to do a PE application on them or what direction you would need to go. Because in some situations, there are other ways that you would need, other procedures that you would use and not doing a PE application. And we'll go through, some of those scenarios in just a moment. So if you screen an individual and it shows that they are active and is active on full Medicaid, then you're not going to do a predetermination on these individuals. You're not going to complete an application on them. That means they already have Medicaid, so they don't need presumptive. They already have Medicaid. So you would just let them know you already have Medicaid. If you need to report any updates to your case or any changes to your cases, then you need to report that information to DFACS. So we're going to skip over to slide 25 for just a moment and come back. So on slide 25, this is the whole list of full aid categories that we have that someone can be active on. So if you look in the system and it shows that they're active, it will give you what aid category they're active under. So if it lists one of these that are on this chart, they have full Medicaid and you will not do a PE application on them. That means you stop right there. You don't need to go any farther. You don't need to fill out an application. You don't need to do an interview. You don't need to do any of that. You just let them know if they have updates or changes they need to report. They need to report it to DFACS, and they can go online to the DFACS, the Gateway web address, which is at the bottom, and it's www.gateway.ga.gov, or they can call the 1-877-423-4746. And then the A category that is highlighted in yellow is women's health. We're going to look at a different procedure for that, especially is really dealing for the pregnant women, but we're going to actually see a call for that. And then the one is highlighted in turquoise, that's SSI, and we're going to see a different procedure for that. Okay, so remember, if you screen them and they're active on one of these aid categories in this list, do not complete a PE application on them. Let them know if they need to report anything, they need to report it to DFACS. So we're going to go back to slide 21. If you make an eligibility check or screen an individual and it shows that they're active on P4HB, which is Planning for Healthy Babies. If it shows they're active on P4HB, the aid category is 180, which is your inter-pregnancy care, or 181, which is your family planning, then you're really going to treat them like they don't have Medicaid. And that's because Planning for Healthy Babies is not full Medicaid. It's just a waiver of where they receive, certain types of services in regards to family planning. So it's not really full Medicaid. So that's why these individuals that are active on this aid category are eligible to apply for presumptive eligibility. So in that case, if you have an individual that is active on P4HB, 180 or 181, you will complete a PE application on them. So that means you're going to go through the whole PE application process. If they are eligible, you're going to add them to gametes. And then the next thing you're going to need to do is you're going to need to notify the Department of Community Health, or DCH, notify us that that P4HB case needs to be terminated. Because once an individual, becomes eligible for another A category, then that means that they no longer need to have that Planning for Healthy Babies case because they're not eligible for another type of A category. So you're notifying DCH that we need to close that Planning for Healthy Babies case. And we're going to look at the PE manual update form and all of that. So again, if they're active on Planning for Healthy Babies, you would just treat them like they do not have Medicaid, and you'll go ahead and do a PE application on them. If approved, you're going to add it to GAMIS, and then also you're going to complete an update form to let DCH know that that Planning for Healthy Babies case needs to be terminated. If you have an individual and she's pregnant and she's trying to apply for presumptive, and once you screen her into GAMIS, if it shows she's active on one of these A categories that we're going to go through, these are the steps that you would need to take. If the individual is pregnant and active on Women's Health, that means she already has full Medicaid, so she needs just to report her pregnancy to DFACS or to her caseworker. So that's the step that you would need to take with that particular individual. Even if the individual is not pregnant, they're just trying to come in and apply for presumptive. Maybe for some reason they don't know that they're active on Women's Health. So again, you will refer them to DFACS or to their caseworker to report any type of changes. And Women's Health Medicaid is for individuals that have been diagnosed or in treatment for breast and or cervical cancer. So again, especially if you have a pregnant woman that is active on Women's Health, you will let her know that she would need to report that information to DFACS, or she can report it to her caseworker, or either she can go online to the Gateway web address. Or if you would like, you can send an email to the Women's Health email address that is listed here about that particular individual. When you are sending information that has PII or PHI information in it, please make sure that your emails that you're sending are sent secure. So applications you're going to be sending over to DCH, so all of those applications are going to have to be sent secure. So however your IT department has your email set up where you can send them securely, just please make sure you get with them to make sure that you understand how to send information securely, or to make sure that your emails are set up already as secure when you're sending things. So you can either send it, they can show you how to encrypt the email, or they can show you how to send it with a password in a separate email, or if you already have it set up with the languages already, out there, once you send it, then that's fine. So however you need to do, or whatever you need to do to make sure that your emails are set up to send things securely, please make sure you do so. If an individual, woman is pregnant and you screen her and it shows that she's on SSI, and that was the A categories highlighted in turquoise on that chart on slide 25. So if you see that the individual is active on SSI, then you're not going to do a PE application on those individuals. What you're going to do is to complete an SSI pregnant women update form. If you go to slide 23, this is what the SSI pregnant women update form looks like. So you're just going to fill in the member's information here at the top, their name, their ID number, their social security number, the number of weeks they're pregnant, the expected due date, and the number of fetuses that individual is expecting. And then you're going to fill in your information down here at the bottom, your name, the name of your hospital, your phone number, and the date that you emailed it. And you're going to email it to this address up here again, the pcorrections@dch.ga.gov. And you will find out that mostly everything that you're sending to DCH will be going directly to this email address. Then again, this information needs to be sent securely. So again, if the individual is active on SSI and pregnant, please make sure you complete this form right here. If the individual is pregnant and they're active on Q-Track, and that's your QMB or your SLMB, then what you would need to do is you're going to treat them like the Planning for Healthy Babies. So you're going to follow the same process you would for the Planning for Healthy Babies. You will complete a PE application on these particular individual, and you will make a PE determination to see if they're eligible or ineligible. If they are eligible, you will add the PE to gametes. And then you will send a PE packet over to the PE corrections email address. And then the body of the email for these particular individuals, you're just going to indicate that this individual is active on Q-Track also. So that's all you have to do. So let's review. For Planning for Healthy Babies, you will do a PE application on them. So you're going to go through the PE process. Once they have been deemed eligible, you will add the PE to gametes. And then later on, we're going to look at in just a moment of how to complete an update form, because you're going to have to complete an update form to let DCH know that we need to terminate that Planning for Healthy Babies case. If an individual is active on Women's Health, they need to report any information to DFACS or to their caseworker, or they can go online to the Gateway web address. If an individual is pregnant and active on SSI, you need to complete the SSI Pregnant Women Update form and email it to DCH. If the individual is active on Q-Track and is pregnant, you're going to complete the PE process to determine if they're going to be eligible or ineligible. If they are eligible, add the PE to gametes, and then when you're sending your PE packet to DCH, in the body of the email, you're just going to indicate that this individual is active on Q-Track also. Remember, if you have questions as we're going along, please make sure that you are writing them down. If you screen an individual and the member is active on inmate Medicaid, then you're going to need to ask that individual if they have been released. If they have been released, then you're able to go ahead and start the PE process, do your application and everything, do your interview. And then once you do that, if you determine that that individual is eligible, on these individuals, you will not add the PE to gametes. Instead, what you're going to do is you're going to send, there are two separate emails you're going to be sending. One email is going to come directly to my email address. You're going to send me the 632H, and we're going to talk about, you're probably saying, well, Kanita, what is the 632H? That is actually your PE application. So we're going to go through all the forms in just a moment. So you're going to be sending the 632H, which is your PE application that you're going to complete. And then you're also going to be giving me the release date. Once you send me that information, I will have to verify that this person actually has been released. And if I'm able to verify that information, I will go in and add that PE to the gametes web portal and reach out to the member to let them know that. And then the next step you would need to do is to send your PE packet to the PE corrections email address. And we'll talk about what a PE packet is. Okay, so remember, anybody else that we didn't go through, and that is on that list on slide 25. So anybody else that is on this list right here, then you make sure you refer them to DFACS to report any type of changes or updates to their case. Okay, now we're going to go through our forms. These are all the forms that you're going to be using when you're making a PE determination. So this is everything that you would need to have. And all of these forms were located in your training material emails. So I hope you printed those out to have a bigger copy. And you can write on those copies, just to make yourself notes or anything, or always you can, write on the PowerPoint on those particular slides for the forms. So we're going to go through each one of these slides to make sure that you understand when you use them. And right now, since we're going through the COVID-19 pandemic, you right now have two options of how you can do or how you can take PE applications. You can either do your interview with the individual at your particular hospital, meaning that they're face-to-face with you, or you can take in PE application over the phone. So we're going to talk about those two separate processes. And the one that the PE process that you take, or the PE application that you take over the phone, that is just right now while we're going through the COVID-19 pandemic, because we had to come up with some way in order to keep everybody safe. So that was an option that we came up with to allow hospitals to take PE applications over the phone. So we're going to talk about those two separate processes. So your first form that you always need to complete if someone is applying for presumptive eligibility is to complete the PE application, which is your 632H. At the top will always be the name of the form. Bottom left-hand corner will always be the form number along with the last revision date in parentheses. So again, this is your PE application that you need to complete on each individual that is applying for presumptive. This form is, most of the forms are in PDF and they are in the form-like style, so that means that you can type on it. So if you're able to type on it, I highly recommend that you type that information out. But if you don't want to type and you're going to handwrite it, please make sure that you are writing clearly and legibly, because this form right here will be part of your audit process. So this is one particular form that we do audit as part of the performance standards. So we have to be able to read that information. So just be mindful of that if you are handwriting this information. We will go through later on in the presentation of each field and then how to fill it out completely, since this will be part of the audit process. There are 2 pages to this application. The first page is where all of your information is really going to go on. The second page right here is only going to list other people that need to go on this application, but they cannot all fit on page 1. Because on page 1, you see you really only have 1, 2, 3, 4 lines for 4 people. So if they have more than 4 people that need to be inputted on this application, that means you're going to put 4 people on page 1, and then you're going to put the remaining people on the second page. The individual name that is the applicant that you use on page 1, please make sure that you use their name again on page 2, and then the ID number that you put on page 1 should be the same ID number you put here. So again, the first 4 people on page 1 and then the last remaining people on page 2. So that is your 632H, your PE application. Your next form is your notice of action. This is how we notify them in writing that they have been either approved for presumptive or they have been denied. So this is your 634H. The left-hand side is your approval notice. So you're just going to fill in the member's information right here along with their ID number, and then your information will go down here and you sign it. And then if it was denied, again, their information will go up here at the top. But instead of putting their ID number, this time you need to choose the reason why they were denied. You would just click on that drop down box to choose the reason why they were denied. And we will go over those 7 reasons in just a moment. And then, of course, you complete your information down here along with your signature. So again, this is how they are notified in writing that they have been either approved or denied. And later on, you will see also if they are approved, you will be able to print them a temporary certificate from the GAMIS web portal once you enter them in the system. And then in that case, they're going to get this along with the temporary certificate. Again, this is your 634H, your notice of action, either approval or denial. Your next form is your 5460, which is your HIPAA form. We should all know about that. And so the last page is the signature page. So if the individual, if you're doing this application with the individual right there in the office with you, they will need to print their name, sign, and date the last page, and you need to keep that last page. But if you're doing the application over the phone, you're just going to be sending them this whole form to them. They don't have to sign anything and send it back to you. You're just going to be sending this to them. But if they're in the office with you, you need to keep the last page with their signature, date, and their printed name. Again, this is the 5460, the HIPAA. The next one is the full application. So if they are applying for full Medicaid, this is the application that they would need to complete. And along with this application are 3 associated attachments, and those attachments will need to be completed if it is applicable to that particular individual. So the first picture that you see right here is actually the cover page for the full application. The full application is like 8 pages long, so this right here is just showing you the cover page. So if an individual, and you're going to be asking them if they want to apply for full Medicaid. If they want to apply for full Medicaid, this is the application you would need to give to them, and they would need to complete it at the same time you are doing the interview with them for presumptive. So while you're getting the information about presumptive and, making the determination and putting it into gametes if they're eligible, while you're doing that process, you would give them this form to go ahead and complete, because you would need to have this form sent over as part of your PE packet. The only exception to the full Medicaid application is our pregnant women. You're not going to ask them if they want to apply. They're going to always be required to apply, even if they say, well, I already applied. Go ahead and have them fill it out. They have to apply, because we don't know if DFACS has that application or what happened to it. So if they apply for presumptive, they're going to have to continue. They're going to have to still apply for full Medicaid. But anybody else that was approved for parent, caretaker, children under 19, or former foster care, you're going to give them the option or ask them if they would like to apply. And if they do, you're going to give them this form. The first attachment, if it's applicable to them, they would need to complete attachment A, and that means if they have other health insurance and it, it's through a job, meaning that you have a job and then you're paying for health insurance is coming out your check, then they would need to fill out attachment A. Attachment B, if they are an American Indian or Alaska Native, they would need to complete attachment B. Attachment C, if they are appointing someone to act on behalf as their authorized representative, or they have a power of attorney, that they would need to fill out that information. Or if somebody is assisting them in completing this full application, they need to complete the bottom of part, attachment C, and that can be you all. So if you all are assisting them, because that's one thing we want you all to do. If they're applying for full Medicaid, please make sure you are assisting them in completing this form. So in that case, you will need to fill out the bottom part of attachment C. Again, the 94A is required for pregnant women, but it is optional for all the other 8 categories. This is your 94A full Medicaid application. Okay, your DMA 285, third-party liability. This is for people who have other health insurance, whether it's through a job or not through a job. If they just have other health insurance, I'm not saying that they are already on Medicaid or Peach Care for Kids, nothing like that. We're talking about commercial insurance, other private insurance like Blue Cross Blue Shield, Aetna, TRICARE, anything of that they're actually paying for themselves, then they need to complete the DMA 285. And then if available, if they have a copy of their insurance card with them, please make a copy of that insurance card, the front and back, to send along with the DMA 285. But if they don't have available, that's fine. They still will need to complete as much information as they can on this form. Again, this is the DMA 285, the third-party liability. The next one is the Notice of ADA Section 504 rights, and this is just information about ADA disability. This is not really a form, it's just more for informational purposes, but a copy of this particular form needs to be included in your PE packet, and a copy also needs to be given to all of your applicants. It can be one per household. It doesn't have to be each individual person in that household, just be one per household. But each applicant that is applying will need to get a copy of this, and a copy will also need to be sent in with their PE packet. And this is going to be part of your audit process as well up on the forms. So if this form right here is missing, that will be an error that you're going to be counted off against for not having that. So again, a copy in your PE packet and a copy to your applicant. Okay, so those are the main forms that you're going to be doing. So you have your 632H, which is your PE application. You have your notice of action, your 634H, either approval or denial. You have your 5460, which is your HIPAA. You have your DMA 285, which is your third-party liability, and then you have your 94A, which is the full application. It's required for pregnant women, but it is optional for other people. And then you have the notice of ADA Section 504 rights. Now, the next form we're going to talk about is the PE manual update form. So I kind of touched bases on this just a little bit. Remember, I was telling you about the Planning for Healthy Babies. If they have Planning for Healthy Babies, you would need to complete this form because you're notifying DCH that that P4HB case needs to be terminated. So these are the situations or the scenarios you would when you would use this particular form. So if you're unable to add the PE to gametes for whatever reason, maybe you don't have internet access or either gametes is down one day. So if that's the case, you're going to go through and do your interview, complete all of your forms and all of that, make a PE determination. Once you have done that, if you're trying to go in and add them and you get an error message or something's not working or you don't have internet access, that's when you will fill out this form and send it to DCH and we will add the PE to gametes. If the P4HB needs to be terminated, you need to complete this form. If you mistakenly selected the wrong aid category for that particular person and you've hit submit, once you hit submit, you cannot go back and update anything. So if that's the case, then this form will need to be completed. And then also, if the member's information in the system is incorrect, and once you're adding them, you will be able to have the opportunity to update some of the information, but some of the information may be grayed out that you cannot update it. If that's the case, that is when you will complete this form. So let's go over to slide 35 and show you what the form looks like. So this is what the form looks like, the PE manual update form. So up here, you need to make sure you put the date that you're completing this form. And the PE manual update forms really should be completed the same day and sent to DCH the same day that you did the PE application. So if you did a PE application on March 1st, then you need to be trying to send your PE manual update that date. But if you can't, that's fine, because all update forms that are received before 5 p.m. will be updated the same business day. But if it's after 5 p.m., it will be updated the next business day. Once you have this form completed like it's supposed to be completed, you're going to be emailing it to the PE Corrections email address, and it's listed on this form. The subject line, you're just going to put PE manual update, and then it's going to ask you to check one of these boxes, either pregnant women PE, hospital PE, or WHM, which is women's health PE. You're going to always check the middle one that says hospital PE because that's what you're doing. You're doing the hospital PE program, so you're going to always check that middle box. Even if you're doing this form, completing this form out for a pregnant woman, you will not check the first box. You will always check the second box. The first box is for health departments. The first box and the last box are for really health departments. But you will always check this middle box. Down here, it says, please check below which update or updates needs to be completed. So that means you're not going to be filling out this whole entire form. You're only going to check and write down the information of what needs to be updated. So if it's just the name that needs to be updated, you're going to check the box right next to name, and on that line, you're going to put the whole name or what the name should be in gametes. If it's the address, the same thing. Check the box and put the address of what it should be. It may just be the zip code, but I will prefer that you put the whole address so we can make sure that we have the whole address. So I gave you 3 examples of what fields to fill out if you have that particular scenario. So for example 1, if a woman is on P4HB and she was approved for presumptive, remember you would need to complete this form. So besides the date and check in the middle box, you would go down here and locate the field where it says terminate P4HB. You would check that box, and then you go down here to the bottom, print your name and your telephone number, and that's it. So you would not give us the name, address, social security number, date of birth. You won't give us all of that. But what you will have to do is to send this form along with the PE application, because it tells you right up under here where you check hospital PE, it tells you to attach form 632H. So when you're sending this form, you need to make sure you have two attachments, or either they need to be together. You need to have this form along with the 632H, and that's how we get the demographic information for that particular individual. Example 2, if for some reason we need to add this information to gametes, then these are the fields that you will need to fill out. You go down to where it says add PE eligibility to gametes. You're going to check that box, and right beside it is asking you to provide the PE period. So remember, we talked about that earlier. It's the start date, the application date, to the end of that next month. So that's what you're going to put on that particular line. Now, on that same example, if a PE needs to be added to gametes, those are the fields that you would need to complete. But if it is for a pregnant woman and it needs to be added, there are two additional fields that you would need to complete for a pregnant woman that their PE needs to be added. So besides those two fields that we just went over, you're going to also complete the field that says expected birth date of fetuses. Check that box and put the due date right there. And then you're also going to fill out the field where it says number of birth. Check that box, and on that line put the number she's expecting. So for a pregnant woman, it would be those 4 fields, but for the other 8 category, it's just going to be the add PE eligibility to gametes and the PE period. And then the last example, if you mistakenly put someone in the wrong aid category and that needs to be updated, go down to the field where it says update PE aid category, check that box, and right beside it, it says correct PE aid category. Click on that drop down box and select the correct aid category that individual is supposed to be in. And then you're going to go down here, print your name and your telephone number, and that's it. So again, do not fill out this whole entire form. Only fill out what is applicable depending on the situation that you have. Let's go back to slide 34. So again, you're sending this form along with the 632H. Sorry, this is supposed to say 632H. So let me update that right quick. Sorry about that. So you're going to be sending your 632H along with the update form. And then if you are doing this form over the phone, you're going to be sending the attachment A, and we have not looked at the attachment A yet. But if you are if you're doing the application over the phone and you have to send this update form, please make sure you are attaching a copy of the attachment A. And you will see why, because on the 632H, if you're doing the interview with the person right there in the office with you, they're able to sign that application. But if you're doing it over the phone, they're not able to sign the application. Instead, we have developed an attachment A, is where you're going to be reading some statements verbatim to your applicant. They're going to have to acknowledge and give their verbal consent. And once they do, you're going to be signing on their behalf. So that attachment A will serve as the applicant's signature for that application. So if that's the case, then we need a copy of that attachment A just to verify that you signed on their behalf. So that's why you're going to be sending the attachment A if you did this particular application over the phone. If the name, date of birth, social security number, or citizenship needs to be updated in the system, that is verification that DCH needs in order to update it. So if they have that available and you're able to get a copy of that, please make sure you're sending a copy along with this form. If not, then we will reach out to the member to get that information. But if you have it, it would be highly recommendable that you send that along with this form. Any updates that needs to be completed should be only completed on individuals that have been approved for presumptive. So that means that they're currently active on presumptive. If they're not active on presumptive anymore, they need to report any type of changes or updates directly to DFAC. So we're only going to update information only for people that are currently active or approved for presumptive. When you're sending this update form, you're going to be sending two separate emails because you're always going to be sending your PE packet to us. So if you have to do an update form, do not include this update form with your PE packet. Your PE packet is going to be one email, and your PE manual update is going to be a second email, because your PE manual update subject line should be PE manual update. And then your PE packet subject line should be PE application or HPE application, whatever. So again, if you have to do an update form, please send that separately from your actual PE packet. Okay, now we're going to look at the attachment A. So remember, I was telling you, you have the option while we're dealing with the pandemic, we now have the option to complete PE applications over the phone. So if that's the case, you're going to use the attachment A, and this is an addendum to the PE application, your 632H. So the first page is just information, and it gives you step-by-step of what to do. So you always need to keep a copy of this first page with you at all times if you're doing the application over the phone, because it tells you what to do. So if you follow steps 1 through 9, you will have no issue. It tells you exactly what to do. And then on the second page, these are the statements that you will need to read to your applicants verbatim. And then you're going to ask them, do you understand and agree to these statements? Either yes or no. If they say yes, then you're going to skip this second question, go down here, check the box. You're going to print their name because you're signing on behalf of, print the name of the applicant, put the date, print your name, and then you need to sign it. If they say no, you're going to check the no for this question, and then you have to ask a second question. You're going to ask, should I cancel this application? Because without your authorization, we are not able to process your application. So at that point, we're kind of giving them, okay, if you don't agree to these, are you sure? Because without your authorization, we cannot go any farther with your application. We're going to have to stop right here. We're not going to be able to process it. So that's, giving them a second opportunity before we stop the application process. So if they say yes, of course, you sign on their behalf. Then if they say no again, that's when you will stop. There's nothing else. You can't go any further. So I'm not sure if that will happen. I haven't heard of that happening yet, but not saying that it won't. But if it does, that means you can't go any further. The interview process is over. Okay, so again, if you do a PE application over the phone, once you have read this verbatim and they have given their verbal consent and you sign on their behalf, this copy always has to be sent as part of your PE packet. And then if you have to do an update, remember to include this as well. So a copy will be in your PE packet, and then a copy will also be going to your applicant. And we'll go over the process in just a moment, because we're going to look at the process for applications that are done in the office, and we're going to look at the process for the applications that are done over the phone. Okay, once an individual has been approved for presumptive, then you will need to make sure you're providing them with some types of resources. So the first one is the quick guide on presumptive eligibility, just letting them know that they have been approved for presumptive. Once they have been approved for presumptive, any claims will have to be billed fee for service. They will not be enrolled into a CMO once they have been approved for presumptive. Once DFACS, if they completed a full application, once DFACS makes them eligible for full Medicaid, then that's when they will be enrolled into a CMO. But for presumptive, they're only going to be fee for service. The next one is an Understanding Medical Assistance booklet. This is just letting them know how Medicaid works in Georgia, how to apply, the different types of aid categories we have, what it covers. It goes into the CMOs a little bit, so it just gives them some good information if they don't already know about Medicaid in Georgia. So this is a booklet. So I'm just showing you the cover page of the cover of the book. So if you need to order these booklets and you don't have them at your particular facility, there is a form on the Gammons web portal that you would need to fill out and send it back to the email or to the mail address to the address that is listed on the form. So if you log onto the Gametes web portal, or just go to the Gametes web portal, which is www.mmis.georgia, that's GEORGIA.gov. So www.mmis.georgia.gov. Once you get on that web page, you're going to click at the top where it says provider information, and then you're going to select the one that says forms for providers. Once you click on that, that's when you're going to look for this form called the DMA 292. Once you locate that form, click on it. It will come up in another window in PDF. You're just going to print it out, fill it out, and then mail it back to the address that is listed on that particular form to indicate the quantities of booklets that you are requesting. Once you complete it and send it back in, they will, package up your booklets and send it to you. Now, one thing to consider is that they do not ship those booklets to a P.O. box. They only ship to a physical address, so it has to be a physical street address. And these booklets are free of charge. Okay, the next information you should be providing your applicant is Planning for Healthy Babies information. So there are two types of brochures or information. Is one for people that have had babies, new mothers, and then it's one just for young women. So it's just telling them a little bit about what Planning for Healthy Babies is. Like I said, it's just, a waiver that is, helping people plan out their families. So it's just, certain services that they receive for this particular program. It tells you what is kind of covered, what they can possibly get. And this is not an all-inclusive list, so it's like their annual physical exams, birth controls, multivitamins with folic acid, family planning, counseling. They have a component called Resource Mother, which is like case management. It tells you who's eligible, and then it also tells them on the back of who can apply. And this information has been provided to you as well as part of your training material email. So that's the first one for brochure for new mothers, because at the top it'll say just had a baby, rolling off pregnancy Medicaid. So this is really good for a pregnant woman, especially once they go through their 60-day postpartum. If they're not eligible for any other type of Medicaid, then they possibly could be eligible for Planning for Healthy Babies. And then the next one is for just young women. It's really the same information, letting them know what Planning for Healthy Babies is, what's covered, how they can be eligible, and then how they can apply. Now, individual can apply just for Planning for Healthy Babies with you all. So if they want to apply for a Planning for Healthy Babies, you would just give them that 94A form and have them to fill it out, and then you can send it back to this address right here, or you can fax it. There's a fax number on here. You can fax it or email or mail it back to this address right here, or you can let them know they can send it back to that particular individual or that particular office. Okay, now we're going to get into the eligibility requirements. What type of verification are we going to require of people applying for this program? So remember, I was telling you about the eligibility criteria. They have to be a U.S. citizen, a qualified immigrant, a Georgia resident. Income must be at the income limit. Of course, if they're pregnant, they have to be pregnant. If they apply for pregnant women, they have to be pregnant. So for all that criteria, we're just going to accept their statement. There's no verification needed. There's no check stubs needed. There's no verification of pregnancy needed. No verification of citizenship, immigration status. We have to take their statement on everything, okay? So verification is not required at this point. We know that people are not going to be truthful, so we do not penalize you all for that. So when we're doing our auditing, we just go by the information that you have on those forms, especially that application, because we're not there in the interview with you. So we we know that you're taking these statements. So whatever you have on the application, we know that's the information that they gave you. But you just have to make sure that you are completing the forms out correctly. So like I said, they have to be a U.S. citizen, a qualified immigrant, a Georgia resident. If they're applying for formal foster care, they cannot have reached their 26th birthday yet. And then they also meet the appropriate age. And what I mean by this is that, Georgia has not expanded Medicaid. So if an individual is between the ages of 19 and 64, they're not pregnant, they're not blind or disabled, then there's no age category that we would have that they would meet for Medicaid. So they would not be eligible for Medicaid in Georgia. So that's what I mean by the appropriate age. Because if you've seen earlier with our age categories that you're going to be making P determinations for, they have to be a parent or a caretaker with a child under the age of 19. They have to either be a child under age of 19, they have to be pregnant, or either they have to have been in the foster care, aging out at the age of 18 or older, and have not reached their 26th birthday. So if they don't meet those categories, then of course they're not going to be eligible for presumptive. Now, if the person does provide you with, verification of anything, then of course you're just going to make a copy of that and send it along with your PE packet, but it's not required to make a PE determination. So the first criteria we're going to talk about is about the citizenship immigration status. Even though we're taking their statements, we really have to ask a little bit more probing questions in order to determine if a particular individual is a qualified immigrant. Of course, with U.S. citizen, all you're going to ask, are you a U.S. citizen? And they're going to tell you either yes or no. If they say yes, then on the application, the PE application, you're going to see there is a column that says U.S. citizen or a lawfully present immigrant, and you're going to have to put yes or no and for each particular individual that is on that application. So if they are a U.S. citizen, then you're just going to put yes beside, on their particular line. And then the applicant, there is a sworn statement the applicant needs to read because they need to understand that they're declaring under penalty of perjury that they are a U.S. citizen or a qualified immigrant, and then they would need to sign it and date it. But that's the first thing you would ask. Are you a U.S. citizen? You will ask everybody. Or, you can phrase it how you want to, but this is just the interview process that I would do if I'm, doing an application. So I'm going to ask them, are you a U.S. citizen? If they say yes, then I'm just going to put yes. Now to determine if they are a qualified immigrant, there are some criteria that they have to meet in order to determine if they are a qualified immigrant. So once you ask that question, if they say no, they're not a U.S. citizen, then you're going to ask, when did you enter the United States and are you here legally? So based off of that, if they're here legally, then they will let you know when they enter the United States. And then once they tell you the date that they entered the United States, you're going to have to see if they meet one of those criteria based off of their entry date. So if they entered the United States before August 22nd, 1996, then they're going to need to fit either criteria A, B, or C in number 1. So they're either going to have to be a lawful permanent resident, an asylee, refugee, Cuban, Haitian entrants, immigrants granted parole for at least 1 year, immigrants whose deportation is being withheld, battered immigrants, or either victims of severe form of trafficking, or they have to be honorably discharged U.S. veterans or active duty military personnel, their spouse, or their unmarried dependent children. So if they entered the United States before August 22nd, 1996, they need to fit either A, B, or C in number 1. So that's what you're going to do. Ask them, when did you enter the United States? Are you here legally? Then you're going to just go through these criteria. If they enter the United States on or after August 22nd, 1996, then they need to fit either one of these criteria in A, B, C, or D for number 2. So A is that they are a lawful permanent resident, but they have to have been here at least 5 years. B is the same as, in number 1 about the asylee, refugee, Cuban, Haitian entrants, immigrants granted parole for at least 1 year if their deportation is being withheld, if they're battered immigrants, or either victims of severe trafficking. C is that they are a lawful permanent resident with 10 years of employment. That's 40 qualifying quarters. So they have to have at least 10 years of employment under the Social Security system and have not received any types of federal benefits. And then the 40 qualifying hours, if they don't have it, if they are married or either they have a parent and their parent has 10 years of employment on the Social Security system and have not received any federal tested benefits, then they can qualify off of their spouse or their particular parent. And then D is the same as above about the only discharged U.S. veterans or active duty military personnel. So again, if they are not a U.S. citizen, you're going to have to ask when they entered the United States. Based off of that date, they need to either fit the criteria in number 1 or one of the criteria in number 2. If you have a particular individual that comes in and gives you an employment authorization document or an employment authorization card, that does not verify their immigration status. So what you're going to have to do is still go back and ask them when they entered the United States, and then they're going to have to fit one of the criteria either in number 1 or number 2. So that employment authorization document or card does not verify their immigration status. It's just giving them documentation that they are authorized to work in the United States for a period of time, but we still need to know about their immigration status. So you're just going to follow this policy right here. So if they don't fit anything in this policy, that means that they are not a qualified immigrant and they will not be eligible for presumptive based off they're not a qualified immigrant. So that would be their denial reason. Now we're going to get into the budget group. Remember, I was telling you there's one question that you're going to have to ask each applicant. Do you expect to file taxes or be claimed as a tax dependent? And based off of the answer, that's either going to put them as a tax filer household or a non-tax filer household. And then based off of that, that would determine who should be in that budget group and who should be listed on that application. If they're supposed to be in the budget group and they have income that we count, that income will be counted towards the whole household income that will be compared to the income limit. So now we're going to go through the budget group flow chart. So this is the question that you are going to ask each applicant that is applying. Do you expect to file taxes or be claimed as a tax dependent? If they say yes, you're going to follow this arrow right here that says yes, and it points to the box that says apply tax filer rule. So that means this household is a tax filer household, and these are the people that should be listed on that application. It's going to be, of course, that person that's filing the taxes, and everyone that person is claiming as a tax dependent should be listed on that application. If the tax filer, that's the person that's filing taxes, if they're married and living with their spouse, that spouse needs to be included. And then if there's anybody pregnant, we will count the unborn fetus. So if they're pregnant with triplets, we're going to count 3 people. They're pregnant with twins, we're going to count 2. So how many ever they're pregnant with, that's what we're going to count. So again, they expect to file taxes, you're going to apply tax filer rules, and these should be the people in that particular budget group, and they should be listed on that application. If you ask that question and the individual says, no, I'm not filing taxes, and no, no one is claiming me as a tax dependent, then you're going to follow this arrow that says no, and it's pointing to the box to apply non-filer rules or non-tax filer. So that means that this household will be a non-tax filer household. And for the non-tax filer household, these are the people that should be included in the budget group. If the applicant is an adult, it's going to be the adult themselves, their spouse, if living with their spouse. If they have any children under the age of 19 living with them, those children need to be included, and then any unborn fetus. If the applicant is a child, of course, it's going to be the child themselves, the child's parents. If that child is living with their parents, those parents have to be included. If the child has any siblings under the age of 19, they need to be included, and then, of course, any unborn fetuses. So that is the non-tax filer household. If you go back to that question and they say, and the individual says, okay, well, someone is claiming me as a tax dependent, then you're going to follow this second arrow that says yes, and it is pointing to this middle box that says, does the tax dependent meet a tax dependent exception? So that's what I was telling you about when we was going through the eligibility criteria. It said exception per ACA. This is what this comes into play. So there are 3 exceptions that you're going to have to go through to see if that tax dependent meets one of these exceptions. And it's going to tell you whether you need to apply tax filer rules right here or either non-tax filer rules. So the first exception is if the individual is claimed by someone other than their parent or their spouse, then they will meet this exception right here, and you're going to apply non-tax filer rules. The second one is that you live with both parents, and the parents, they can either be married or unmarried, but they're filing jointly. They're filing separately. They're not filing together, they're filing separately, but one of the parents is claiming them as a tax dependent. So if that's the case, then that person will meet that exception. And again, you apply the non-tax filer rules. The last one is the child under the age of 19 that expects to be claimed as a tax dependent by the non-custodial parent. So that means that that tax dependent is living with one parent, but then their other parent is living somewhere else, and that particular parent is claiming them as a tax dependent. So that means that they will meet that exception, and you apply the non-tax filer rules. So if you go through these 3 exceptions and they do not meet one of these exceptions, then you're going to follow the arrow that says no, and you're going to apply tax filer rules. So that now means that this particular household is a tax filer household, and these are the people that should be included. You go down here where it says tax dependent budget group, it's going to be the same as the person that is filing the taxes. So whoever is claiming them as a tax dependent is going to be that particular person. And then whoever that person is also claiming as a tax dependent besides the applicant. So if that person is claiming other people besides the applicant, then those other people have to be included. If the tax filer is married and living with a spouse, that spouse has to be included, and then unborn fetus. So this right here is really good for you to keep. You do have a bigger copy of this because it allows you to make sure that this is the question that you stick to, that you ask this, and based off of that, that would tell you whether you need to apply tax filer rules or non-tax filer rules. And these are the only people that should be included in the budget group and listed on that application. Okay, talk about the MAGI-based income. We kind of touched a bit on this a little bit earlier. In the MAGI-based income, MAGI stands for Modified Adjusted Gross Income, and this is taxable income. But remember, there's other types of income that we include that are not taxable, and that's like Social Security benefits, tax-exempt interest, or foreign earned income. So all of those types of income will be included in the budget for the PE determinations. Now, most of the income that someone has, well, of course, will be earned income, and that's, income that you receive in exchange for the services that you provided. And that could be in the form of wages, salary, commissions, or either self-employment. So that's the most type of income that you're probably going to be used to, is the earned income. With the income, there are 3 deductions that we can allow to subtract off of someone's gross income. So when we're looking at gross income, we always ask about the gross income. So that is the income that they make before taxes are taken out. So when you're asking them if they have any income, you need to make sure that they're telling you what the gross amount is. So they may gross $2,000 but only bring home $1,500. So they shouldn't tell you $1,500. They should tell you $2,000. But of course, again, we know some people are not going to be honest. But if they do that full application, they're going to have to be honest. So once we have their gross income, there are deductions that we can subtract off of that gross income to try to lower their income before we compare it to the income limit. So there are 3 types of deductions that we're going to look at. We have your pre-tax deduction, your 1040 deductions, and then your 5% deductions. The pre-tax and the 1040 deductions, if they have any one of these types of deduction, it would be, you're going to ask about it, and then we're going to automatically subtract it. But for your 5% deductions, we're going to see that this amount here is going to be listed on your income limit chart. And this right here is not going to always be used. It's only going to be used if that particular household is over the income limit. So if they're over the income limit, that's when we would subtract it to try to make them eligible. But if they're already meeting the income limit, then we would not subtract that 5% deduction. So you know your pre-tax deductions are things like your dental insurance, vision insurance, your 401k, health insurance, things of that nature. So it's actually any types of deductions that are taken out of their check before taxes. So that's all you're going to ask. Do you have any pre-tax deductions? And you just can give them some examples and you'd be like, do you have any pre-tax deductions? Especially if they're working, you're going to ask them, well, do you have any pre-tax deductions taken out of your check, like health insurance, like vision insurance, dental insurance? And these are, deductions taken out of your check before taxes. So if they do, again, they can just tell you, yes, I have $40 taken out of my check every other week for, dental insurance, whatever. So whatever they tell you, that's what you have to go by. The next one is the 1040 deductions. So this is just for your information purposes, so you can know what is considered a 1040 deduction. So it's anything, 23 lines 23 through 32, because 23 through 33, because the 34, 35, and 36 is just a reserve. So if they have anything that is listed here, this is called a 1040 deduction. So that can be like your student loan interest, IRA deduction, educator expenses, self-employment health insurance. So if they have anything that is listed here, it can be deducted or subtracted off of their gross income as a 1040 deduction. The note to this is about the alimony, because 31A, if they are paying alimony out, it would depend on when that divorce or that separation was finalized or last modified to determine if we're able to subtract it or not. Because if it happened on or after January 1st, 2019, we can no longer use it as a deduction. It had to have been before January 1st, 2019 before we can allow. So you will have to ask about when it was finalized or last modified to determine if you're allowed to subtract it off as a 1040 deduction. And then the last deduction is your 5% deduction. Remember, I told you this is straight off of your income limit chart. It's in column 2. It says 5% deduction. Again, this is not always used. So if you see that someone is over the income limit, then that's when you would use this amount to subtract off of their income. So let's say you have a household of 2. Let's say it's a mom and a child. And let's say her income, when we did the interview process, she told us her income is $475 a month. So if we go over to a budget group of 2, and we go over to the column that says parent caretaker, the income limit is $457, but she said her income is $475. So if we look at that, we see that she's over. So what we need to do is subtract that $72, which is the 5% right here. $73. We need to subtract $73 from her income, which is $475. So once we subtract that $73 from her income is now $402. So then we compare it to the income limit. Now she is eligible. They are eligible for parent caretaker based off of that. And of course, remember, they still have to meet those other criteria about the Georgia resident, U.S. citizen, qualified immigrant, and all of that. So they have to meet those other criteria. We're just really talking about income right now. So this is your income limit chart that you were going to be comparing the whole household income to. So if they have more than one person in that budget group that has income that is includable, you're going to add that income up and compare it over here. If they have any pre-tax or 1040 deductions, of course, you're going to subtract those two deductions first, and then you will compare that income to the income limit to see if they meet the income criteria. So this is the budget group. You're going to go based off of the budget group size. This is the 5% column, so it's only going to be subtracted if it's needed. This column is for your parent caretaker with children. So this is the income limit that they have to meet. And this is a monthly amount. So your income limit chart is always a monthly amount. And then for your children under 19, there are three columns that you will look at, because children under 19 income limit goes based off of their age. So if their age is 6 through 19, then you're going to look at this column right here, the 133%. If their ages 1 through 5, you're going to look at this column right here, which is 149%. And then, of course, if they're 0 through 1, meaning they're newborn, you're going to look at this column right here, which is 205%. So based off of their age, that is the particular columns that you're going to look at. And then your last column is your pregnant women. And then, of course, you don't see anything for former foster care, because remember, we don't look at income for them. And this chart is updated annually. So next year, you're going to use this chart because it was just effective on March 1st, 2021. So next year, if you're still, doing this program, you will receive a new chart for 2022. Now we're going to talk about income and how we calculate their income and the deductions. So everything has to be in a monthly amount, because that's with the income you see on the chart, that's a monthly amount. So their income has to be in a monthly amount before we compare it to the income limit. So if their income or their deductions is not in a monthly amount, then you're going to use what we call a conversion factor in order to convert it over to a monthly amount. So your conversion factors are over here. So it's based off how often they're paid or how often they pay out those deductions. These are the deduction factors that you're going to use. So if they're paid or their deductions is taken out weekly, then you take that amount and multiply it by 4.3333. So for instance, if someone is paid $300 a week, then in your calculator, you're just going to put 300 times 4.3333. And that would give you $1299.99. So that would be your monthly amount, the $1299.99. If a particular individual is paid biweekly, you're going to take that biweekly amount. So let's just say this individual is paid $300 every 2 weeks. So 300 times 2.1666, and there are 3 sixes after the 1. And that monthly amount comes out to be $649.98. If the particular individual is paid just twice a month, it's not every other week, it's just only 2 times out the month. So you would take that 300 and multiply it by 2, and your monthly amount is 600. Then if they give you your annually or yearly amount, you just divide it by 12 to get the monthly amount. So if someone is paid hourly, so let's say someone is paid $17.50 an hour, and they work 30 hours a week, and they're paid every week. So $17.50 times 30, that's $525. So every time they get paid every week, they're paid $525. So if they're paid weekly, you just take that $525 and multiply by 4.3333. And your income comes out to be $2,274.98. Now the calculator actually gives you for that amount is $2,274.9825. So you're just going to take the two numbers directly after the decimal point, and you're not going to round anything. You're going to leave it as is, $2,274.98. So now we're going to go through some examples so you can make sure that you are comfortable in converting over. So you have an applicant works and earns $189 every 2 weeks. What is the monthly income? So the conversion factors for every 2 weeks is times 2.1666. This is every 2 weeks. This is not twice a month, every 2 weeks. So on your calculator, make sure you clear it out each time. And you're just going to put 189 times 2.1666. And your answer should be $409.48. I know it says 0.4874, but remember, drop off all the other numbers except for two numbers directly after the decimal point. So it's 409.48. An applicant receives workers' compensation of $225 every week. What is the monthly income? So you're just going to take that, clear out your calculator again, and you take that 225 times 4.3333, because that's every week. And your income should be $974.99. An applicant pays $25 for dental insurance semi-monthly. What is the total monthly amount for the pre-tax deduction? So this is just twice a month. So you just take that 25 and multiply it by 2, because that's conversion factors for semi-monthly, and your answer should be just $50. So again, you just take that amount and multiply it by the applicable conversion factor. So if it's weekly, it's times 4.3333. If it's every 2 weeks, it's times 2.1666. If it's semi-monthly, it's times 2. If it's monthly, it's times 1. And then if they give you yearly or annual amount, it's just divided by 12. Fluctuating income. Fluctuating income is income someone receives, but it's not always the same that every time that they get paid. So every time they get paid, it's a different amount. So how would we calculate that income? So here's an example that I gave you. An individual was paid $115, $112, and $90. So what you're going to do is to add those income amounts up together to get your sum amount. So when we added these three amounts up, we got $317. Then what we need to do is to take an average of these amounts. So you're going to divide by the number of amounts that they gave you or they received. So in this situation, they only received 3 pays. So we're going to divide that 317 by 3. And the average pay comes out to be $105.66. So that's like an average. That's just, normal calculation of how you would average something. And then you would take that average pay and convert it over to a monthly amount based on how often they're paid. So if they're paid weekly, you multiply by 4.3333, bi-weekly times 2.1666, semi-monthly is times 2, and then monthly is times 1. So again, add your pays up all together and then divide by the number of pays received, and then you take that amount and convert it over to a monthly amount based on how often they're paid. Okay, our examples. We have an applicant who works and is paid every week. The applicant was paid $225, $230, $235, and $245. What is the monthly income? So again, clear your calculator out. You're going to put 225 plus 230 plus 235 plus 245. Once you add all of those amounts up, you should get a total of $935. Now we need to do an average by dividing by the number of pays received. And in this scenario, they received 4 pays. So you're going to divide that 935, going to divide it by 4. And the average pay comes out to be $233.75. So every time they get paid, this is what they're averaging out to be paid. So now we need to convert this over to a monthly amount based on how often they're paid. They're paid every week. So you're going to take that $233.75 and multiply by 4.3333. And your amount should be $1,012.90. Because the 90 is directly after the decimal point. An applicant working is paid every 2 weeks. The applicant was paid $11.50 and $11.67. What is the monthly income? So again, clear your calculator out. Put $11.50 plus $11.67, and you should get $2,317. We're going to divide by the number of pays they received, which was 2, so divide by 2. which is $1,158.50. But that's just the average. So now we need to multiply it by the conversion factor for every 2 weeks, which is times 2.1666. And now your answer should be D, none of the above. And it should be just $2,510 because the 2 zeros are directly after the decimal point. So it's just $2,510. And then the last example, you have an applicant works and is paid monthly. They was paid $2,500 and $2,670. What is the monthly income? So add $2,500 plus $2,670, and you should get $5,170. They had 2 pays, so divide that by 2. You get $2,585. They're paid every month. So just multiplying it by 1, so it's just $2,585. So again, fluctuating income, make sure you add all your pays up together to get a sum amount, to get the total. Then you divide that total by the number of pays they receive, and then you take that average amount and convert it over to a monthly amount based on how often they were paid. Okay, here's a list of some types of income that someone may have, but we don't include it. So if we don't include it, you will not list it on that PE application. They still would have to list that particular income on the 94A if they are, completing the full application. But for PE purposes, if they have income that we do not include, do not put it on the application, because if you do, then you're going to try to include it when it should not be included. So the most types of income someone can receive that we're really familiar with are like child support, veterans benefits, SSI contributions, anything of that nature. So this is not an all-inclusive list. So this is just the most familiarized type of income that are excluded that someone can receive. If a child has RSDI income, it depends on their situation to determine if it's going to be included or not. So if a child has RSDI income and they live with their parent and have no other income, then no, we would not include it. So if they're living with their parent and the RSDI is the only income that they have, we would not include it. But if that child receives RSDI, does not live with their parent, they're living with someone else, and their parent is not claiming them as a tax dependent, you will include it. Or if that particular child meets the IRS tax filer threshold, meaning that they receive income that is over the threshold amount for that particular year. And if they are, that means that they're required to file a tax return. So in those situations, you would include it. But otherwise, you would not include it. So if they live with their parent and they have no other income, it is excluded. If they meet the tax filer threshold, it is included. And then if they live with someone other than their parent and their parent is not claiming them as a tax dependent, it is included. And then also I want to recognize to get a full list of incomes that you might not be familiar with and you need to know whether it's included or excluded, please go to the GAMIS web portal again, which is the mmis.georgia.gov. And at the top again, you're going to click on provider information. And this time you're going to select the ones that says, I think it says provider manuals or manuals for providers. I think it says provider manuals. So you will click on that and you will look for the manual called Hospital Presumptive Eligibility. So once you click on that and it comes up, go down to Appendix I. And once you go to Appendix I, you will see a whole chart. It's like 35 pages long. The chart is. The whole manual is like 100 and something pages long. But for the chart, I think it's like 30 something pages. So it gives you a list of, a whole list of incomes, and it will tell you whether it's included or excluded. So it gives you the name of the income, the description of the income, and then it'll give you an I or E for included or excluded. Also, if you look at that income, if it has the word magi or non-magi in parentheses by the letter I or E, make sure you're looking for the one that says magi. But if it doesn't have anything beside it, that means it is for magi and non-magi. But if it specifically spells out magi, make sure you're looking for the magi word, and it'll tell you whether it's I for included or E for excluded. So again, that is up under the hospital PE manual. So now we're going to look at the step-by-step process that you would need to take for this particular applicant. So of course, like I told you, we're going to look at two different processes. One for you doing the interview with the applicant right there in the office with you. And then the next one is going to be you doing the application over the phone. So of course, the first thing you do, remember we talked about this earlier, is you're going to screen them, and we will look at a gamut screenshot of how you do that if you're not familiar with that process. So the first thing you're going to do is to screen them, and that will determine if you're able to do a PE application on them or not. If you are, you're ready to start your interview, you're going to get your 632H and go through that to complete the process. You're going to make a determination to see whether they meet the eligibility criteria for presumptive. If the individuals are eligible for presumptive, then remember you're going to ask them if they would like to apply for full Medicaid exception. Pregnant women, they always should fill out the 94A. And the 94A is for them to complete the full Medicaid and then also to ask for any prior months. So, you know, if they have any bills, you know, in months, at least 3 months prior to their application date, then they can, you know, request to be determined to have a determinations for those months. So it's at least 3 months. Once you have approved an individual on the 632H, then that information that you have on that 632H would just be entered into the GAMIS web portal. You're going to provide your applicant with written notice that they have been approved, which is that 634H, the approval notice, and then also printing out the temporary certificate from GAMIS. Inform them of the PE period, the start date through the end date, and any types of services that are covered, because you need to make sure you're letting your pregnant women know that it only is going to cover their prenatal care and their pharmacy services. And then you need to let everybody know, if they are approved, that pharmacy prescriptions cannot be filled for at least 24 to 48 hours. And then within 5 business days from the date that you do that application, you have at least 5 business days to send that PE packet to DCH. I prefer you to try to send these on a daily basis if all possible, because we never know when we may be out of the office. And if you're out of the office for a certain period of time and you did an application before you went out on leave, then that application is just sitting there on your desk, and you might not know when you're coming back. It may be 2 weeks later, maybe the next day, but it may be a month later. So we never know. That's why we need to get in the habit to try to send these on a daily basis if all possible, but you have at least 5 business days. If you have a defects worker that is located at your particular facility, not sure if that's still going on right now, but if you do, please do not give them this packet or do not give them the full application to go ahead and process. Everything will need to be a part of your PE packet that comes to DCH. You're going to summarize the benefits and answer any questions that they may have. And remember, you need to provide them with a copy of the notice of the ADA Section 504 rights form, the quick guide, the understanding medical assistance booklet, and then the P4HB information. If for some reason they need DFACS contact information, you give them the 1877 number or either the web address to the GATE website. If an individual is determined ineligible, then you will let them know if their circumstances changes, they can come back and reapply for a presumptive. They do not have to wait 2 years because they were not approved. They can come back anytime their circumstances changes. And then you're going to give them their notice in writing, the 634H, which is the denial notice, and you're going to also provide them with the P4HB information. These individuals still are able to apply for full Medicaid, so you're still going to give them the opportunity to apply for full Medicaid. And I want to say, just because an individual was approved for presumptive does not mean that they're going to be approved for full Medicaid. That's a DFACS determination. You all are going to do the presumptive determination. DFACS will do the full determination. And then vice versa. Just because they were denied for PE does not mean they're going to be denied for full Medicaid. So you all do the presumptive determination. DFACS will do the full determination. And then again, you will send this PE packet to DCH within 5 business days. So this is your checklist for you. So if you're doing the application, we just went over the procedures. If you're doing the application with the applicant right there in the office with you, then this is the process that you should go through. And this is what your PE packet should be included with. Of course, you should have the 632H, your 5460, which is the signature page only. All the other pages you should be given to your applicant. The notice of action, whether approved or denied. A copy of the notice of ADA. The 94A, if it's completed. Then also, if it's available, ask them if they have a copy of that ID. And that's, to help DFACS out if they need it. So if they have a copy of the ID, please make a copy of that and send that along. And then if they provide you with any type of verification, you're going to send a copy of that information. If they have other health insurance, remember the DMA 285. And then if they have a copy of their insurance card available, a copy of the front and back of it if applicable. And then you're going to send all this information in a secure email. This is called your PE packet. Send all of this to the PE Corrections email address that is listed within 5 business days. So this is kind of like a checklist for you. You need to go through this to make sure this is what is included in your PE packet if you do the application with the applicant right there in the office with you. Okay, for the telephone process, if you're doing the application over the phone, this is the process that you need to follow. The first thing, you still screen, excuse me, you still screen the individuals into gametes first. If they are eligible to apply for presumptive, that's when you will complete the 632H. And before you make a determination to determine if they're eligible or not, then you need to read the statements that we looked at on the attachment A. Need to read them out loud verbatim. And then your applicant will need to give their verbal consent. Once they have given their verbal consent, then you will make an eligibility determination to see if those individuals are eligible. If they are eligible, you're going to ask them if they would like to apply for full Medicaid. Now, this is the difference here. If you were doing the application in the office with the applicant there with you, they would complete the 94A while you're doing, the PE process. But since you have them over the phone, you're going to have to do the 94A on their behalf. So meaning that you're going to be completing the 632H and the 94A. You're going to be completing all that information while you have them over the phone. And remember the exceptions that pregnant women are required, so you're going to always be completing their 94A. Then once you have determined that they are eligible, you're going to add the information that you have on that 632H. Okay, here's another little mistake. The word to should go right here. Sorry. So you're going to send securely to DCH. I'm sorry. If you cannot, remember we went through the PE manual update process. If you're not able to add the PE to gametes for some reason, that's when you will fill out that PE manual update form. Otherwise, you're going to be adding the information to gametes yourself. And then this is what you need to either email or mail to your applicant because they have to have this information. So you're either going to email or mail this information. You're going to email or mail them a copy of the temporary certificate that you printed out from gametes once you added that, and then a copy of the notice of action, the approval notice, and that's for all individuals that were eligible. A copy of the 5460. This time they don't need to sign it and send it back to you. Just going to send them all pages. a copy of the notice of ADA, and then a copy of that attachment A that you signed on their behalf. So this is what you should be emailing or mailing to all of your applicant when you do their application over the phone. Inform them of the PE period and what services are covered, and then within 5 business days, you're going to be sending your PE packet to DCH. If the individual is ineligible, again, remind them if their circumstances changes, they can come back and reapply. And then this is what you need to be sending to your applicant: the denial notice for all ineligible individuals, a copy of the 5460, the notice of ADA, and then a copy of the attachment A that you sign on their behalf, and send that PE packet to DCH within 5 business days. Now, the attachment A will serve as their signature that they would normally sign on the 634H and then also on the 94A and on the DMA 285. So wherever they had to sign, that attachment A will serve as that signature. So if you're doing the application over the phone, this is what your PE packet should include. It's a little bit different, but you know, there's most of the forms are the same, but there's a little bit difference. So first you're going to have the 632H, a copy of the attachment A that you signed, and then the 634H, whether it was approved or denied, the notice of ADA, the 94A if you completed on their behalf. If they were able to provide you with any verification, you will make sure you send that information. And then if they have other health insurance, you will have to complete the DMA 285 on their behalf as well. And this is the email address, again, that you're sending your information to. So again, remember you have 2 processes, one for the interview that is being done face-to-face with the person at your office, or either done over the phone. So now we're going to get into the reasons why someone can be denied. There are 7 reasons. Of course, if they're not a U.S. citizen or a qualified immigrant, if their income is over the income limit, if they are not a Georgia resident, remember if they're not the appropriate age that we talked about, the 19 through 64, and not pregnant, not blind, not disabled. If they're not a former foster care child, meaning they don't fit the former foster care criteria. Of course, if they're not pregnant, and then if they refuse to give you any information that you need in order to make a P determination, then you know there's no information that you can get from them, then there's really nothing that you can do. So if they refuse to give any information or cooperate, they can be denied for that reason. Now we're going to get through and go through the PE application of how to fill this form out completely. Because like I said, this is one of the forms that will be used for audited purposes and, you know, for your performance standards for the hospital. So at the top left-hand corner, it says beginning, effective for services begin. This is always your application date. So don't put the first of the month right here unless they actually apply on the first of the month. So if they applied on February 28th, you're going to put February 28th, 2021. If they applied on March 15th, you're going to put March 15th, 2021. So you're going to actually put the application dates. Down here is your applicant's information. So whoever is applying, their information needs to go on these lines. So their name, the address, apartment number or lot number, the city, the state, zip code, the county, and that needs to be the name. If it's a woman and she's married, if she wants to give her maiden name, that's fine. Telephone number, and then the social security number. It is optional for presumptive, but if they're completing the 94A, it will be required, but for presumptive, it is optional. Top right-hand corner, it says medical assistance identification number. This should be that 12-digit number that you get from GAMIS, or if they already know it, you know, you put that down. But this should be the number of at least one person that was approved for presumptive. So if they were not approved, but they have a number, I don't need their number. I need the number of the person that, at least one person that was approved. You're going to ask them if they have health insurance, or you're going to check either yes or no. And just be mindful, if you check yes for this box, when I go through your PE packet, you should have that DMA 285 completed, because that's where some people get errors counted all for because they check yes right here, but when I go through the PE packet, I don't see the DMA 285, and then they question me about it, saying, well, I didn't have the DMA 285 because they don't have health insurance, but then when I refer them back to this question, they be like, oh, okay, I see what I did. So if you say yes to this, you have to make sure that DMA 285 is completed. And then you're going to ask if anybody has been in foster care. If they have, then you need to give us the age that they age out of that they left foster care, and then what state. Down here, this is where you're going to complete the information about tax filer, non-tax filer household. We went through that budget group to determine whether they're going to be a tax filer household or a non-tax filer household. So you need to tell me which one they are. Either yes, they are a tax filer household, or yes, they are a non-tax filer household, okay? So a yes needs to be checked or darkened in for one of these. They have to be one of these. Yes, they are a tax filer household, or yes, they are a non-tax filer household. And then on the next lines are where you're going to fill in everybody that is part of their budget group. These are the people that should be listed on this application. So whether everybody is wants to be looked at for presumptive, it doesn't matter. So if they're applying for presumptive or not, they still have to go on this application. Or if they already have Medicaid, if they are a part of that applicant's budget group, they have to go on this application. So on line 1, of course, is going to be the person that you put up here. So that's always going to be your applicant. You're going to fill in their information, the name, date of birth, race, gender. The relation is already pre-populated as self. And then this is the column right here about U.S. citizen or a lawfully present immigrant. So you're going to ask if they're a U.S. citizen. If not, then you're going to go through your policy to determine if they are a qualified immigrant. Then in this section, this is your monthly gross income section and your monthly deduction section. So here you're going to put the letter for the type of income they have. So if they're working, you can put a W for wages, or S for self-employment, or you can put E for earned income. Then right here, you're going to put the amounts. So if they're paid $300 a week, in this amount field, you will put 300. In the frequency field, you'll put W for weekly, or WK. Then the monthly amount, that frequency will let you know if you need to convert this amount right here. So in this scenario that I gave you, $300 a week. So in your calculator, you're going to put 300 times 4.3333. And I think that amount was like $1299.99. That's the amount that goes right here in your monthly amount field. If they pay, individual is paid $300 a month, then in that scenario, you put 300 for the amount. The frequency will be M or MO, and then your monthly amount will still be 300 because it's already in a monthly amount. Your next is your pre-tax and 1040 deductions. All of the pre-tax deduction will have to be converted and added up together before you put the amount on this line. And the same thing for the 1040. So if they have like dental insurance, vision insurance, and they give you like a weekly, bi-weekly, semi-monthly amount, then you know you need to convert each one of them separately, add them up, and then put the amount here. And the same thing for 1040. If they have any pre-tax of 1040, of course, you're going to take those amount, subtract it from your monthly amount field. And then whatever you subtract, once you subtract those two fields, then you will put the remaining amount right here on your monthly net income field. So you're going to do that for each individual person that has to be on this application. If they don't have any income or deductions, then those fields will be blank for that particular individual. If a person in the household is, or in that budget group is pregnant, that pregnancy information will be captured on line 2 with the number of birth that they are expecting, or the number of fetuses they're expecting, what is the due date, and the name, print the name of the person that is pregnant. Then we're going to go down here to where it says subtotal net income. Whatever amounts or amounts are in this column, this last column that says monthly net income, whatever is in this column, that's what you're going to add up and put down here for the subtotal net income. Number in the budget group, how many people are on this application? That should be the number right here. And then the poverty income level, that comes from your income limit chart. So if you're looking at the parent caretaker, so you're going to put that amount here based off of how many people are in the budget group. If you're looking at children under 19, based off of their age and the number of people in that budget group, you put the amount here. So if you, instance, let's say you had a mom and a child, and let's say they met all the criteria, but mom had income that was, let's say her income came out to be $900 a month. So in that instance, if we look at a budget group of 2, the income limit for a parent caretaker is $457. So if we subtract that $73 off of that, her income would still be over the income limit. So in that instance, we can put 457 here because we looked at this budget group for parent caretaker first. But now they met all the eligibility criteria except for the income part. They did not meet the income criteria for parent caretaker. So now that means mom is no longer eligible. She's not pregnant, so she doesn't meet any other criteria for any other aid category. So that means mom is not eligible for Medicaid. So that means nobody is eligible for parent caretaker with children. Nobody's eligible for that aid category. So what we can do is now see if that child is eligible for the children under 19 aid category. So then remember, they met all the other criteria except for the income part. So now we just need to look at the income part for the children under 19. And so based off of how old that child is, then you will look at the income amount for that child. So if the child was 7, the income limit for a 7-year-old for a budget group of 2 is $1931. So on this line, I will put 457, and then I will also put 1931 because I looked at the income limit for the parent caretaker and also the children under 19 income limit. So if you look at more than one aid category for that particular budget group, make sure you put those income limits. 5% deduction, remember I told you this is not always used. So if you see that they're already under that income limit, you do not need to use the 5% deduction, so that field would be left blank. And then your total net income field is still the same as your subtotal net income field. If you do have to use the 5% deduction, then for this line, you're going to get your amount off of your income limit chart. And then if you need to subtract it, you will subtract that amount from your subtotal net income field right here. And then once you subtract these two fields, then that remaining amount will go down here to where it says total net income. Then you're going to determine whether they are eligible or ineligible. Most of the times, or all of the times, you're really going to check eligible. The only time you need to check ineligible is if everybody on this application that was applying for presumptive, everybody on here was ineligible. That means nobody was approved. So that's when you would check ineligible. But if at least one person in this on this application was approved, you're going to always check eligible. Then if they are eligible, what aid category are they eligible for? Were they eligible for parent caretaker? Were they eligible for children under 19? Were they eligible for pregnant women, or were they eligible for former foster care? And remember, for former foster care, you do not even have to worry about this tax filer, non-tax filer household information. You're just going to put that particular individual on line 1, and remember, put their information up here. You're going to leave the income, pre-tax deduction, all of that is going to be left blank. Only thing you need to do right here is to put the number in the budget group, but everything else can be left blank because we don't look at any income for them. And then down here, this is where you ask if they want to apply for full Medicaid. If they say yes, then you're going to check this box. And remember, if it's for a pregnant woman, this box should always be checked. If they say no, you're going to check this box, and then they need to make sure they initial it. And they can only initial it if you're doing this application via face-to-face, and they're right there with you. The applicant needs to read this sworn statement if they're there with you. If you're doing it over the phone, you need to read it verbatim out loud to them. And then, of course, if they're there with you, they will sign it and date it. If they're not there with you, this will be blank, And remember, you're going to be doing the attachment A, signing on their behalf. And then your information down here needs to go at the bottom. You need to make sure you complete each field down here. The date, print your name, put your title, put your phone number, sign it, put the name of your hospital and address, the name and the address of your hospital, and then your hospital provider ID number. So that is how to fill out the PE application. We have a couple of examples that we're going to go through, and you're going to look at how to actually see the application filled out. So if you need to reference back to an application to make sure that it's filled out completely, you will have that information to reference back to. And remember, the second page is only used as if, they have more than 4 people in their budget group that have to be listed. You're going to list the first 4 people on the page 1 and then the remaining people on page 2. And the same name and ID number that you put on page 1 is the same name and ID number you're going to put up here on page 2. And the rest of the slides, the other next slides, are just everything that we went over, just giving you a description, of it, or what you should put in there. And now we're going to go through some examples. And like I said, we're going to go through some examples, and it'll let you know whether we're doing this, via phone or either the applicant's there with you. We're going to fill out the application. And then also, if applicable, if we need to fill out the PE manual update form, then we're going to fill out the PE manual update form. So I wanted you to have this, so just in case you need to reference back to it. So our first example, we have Mr. Map Hay, who's 46. He called, so that means we're doing this application over the phone, wants to apply for PE. He lived with his wife, Paige, his daughter, Teal, and their 2 mutual children, Chip and Allie. Mr. Hayes says that his wife is the one that is working. She's employed and earns $1,050 per month, and she pays $60 per week for dental insurance. He states he will file taxes jointly with his wife and claim all the children as tax dependent. They don't have other health insurance, and no one has been in foster care. So let's go through our step-by-step process of what we need to do. So the first thing we need to do is to screen each individual into gametes to see what gametes tells us. In this situation, no one was known to gametes, so that means that we're able to start the PE process in our interview. We're going to interview Mr. Mapp and complete the 632H. We're going to ask him if he would like to apply for full Medicaid. If so, then we're going to read the statements on the attachment A verbatim out to Mr. Hay so he can give his verbal consent. If he does give his verbal consent, then we're going to sign the attachment A on his behalf. Then we're going to make an eligibility determination to determine if everybody in this household was eligible or ineligible. If they are eligible, we're going to determine what aid category they were eligible up under. And then if they are eligible, we're going to add each individual person to gametes. So once you have approved them on paper, then if they were approved, everybody that was approved, you're going to add each person to gametes. If he wanted to apply for full Medicaid, remember you're going to complete the 94A on his behalf. And then you need to email or mail Mr. Hay his 634H with the approval notice and the temporary certificate for each person that was approved. A copy of the 5460, all of the pages, a copy of the notice of ADA, and then a copy of the attachment A. We'll let him know what his PE period is and that his full application will be sent to DFAX for processing, and you need to send the PE packet to DCH within 5 business days. So that is your step-by-step process that you need to take. Now, let's look at the budget group and the income. Remember, Mr. Hay was filing taxes jointly with his wife and claiming everybody as a tax dependent. So that means he was a tax filer household. So in his household should be him, he's the tax filer, and his wife living together, so him and his wife. And then everybody that they're claiming as a tax dependent, which is all the children. So in this situation, it should be everybody, a budget group of 5. Now, Mrs. Hay was the only one working. She was making $1,050 a month, but she was also paying dental insurance of $60 a week. So $60 a week is a thing that we know we need to convert over to a monthly amount. So what we do is to take that $60 and multiply by 4.3333, and that gives us $259.99. So that is called a pre-tax deduction that we need to subtract off of her income. So her income is $1,050, and we're going to subtract that $259.99. And once we subtract that, we got $790.01. So what we're going to do is to take this subtotal net income and compare it to the income limit chart for parent caretaker for a budget group of 5. The income limit for a budget group of 5 for parent caretaker is $752. Right now, they're over that amount because their income is $790.01. So they're over that amount. So what we need to do is to subtract that 5% deduction to see if they would now be eligible. So the 5% deduction for a budget group of 5 off of your income limit chart is $130. So once you subtract $130 from the subtotal net income, now their income is $660.01. Now we compare that amount to that income limit, which was $752. Now they're eligible, and they're eligible for parent caretaker because everybody met all the other eligibility criteria. So this is their PE application information, the application date. It tells you who the applicant is. It gives you the address, the county, the phone number. It gives you the other budget group members, which was his wife and their 3 kids with their date of birth. And then it says down here that everybody was a U.S. citizens except for Mr. Mapp. He was a refugee. And he was a refugee, remember, from the immigration policy. If they entered the United States before August 22nd, 1996, or on or after, if they are, it was letter B, if they're an asylee, refugee, Cuban, Haitian entrance, all of that. So he meets that definition, so he is considered a qualified immigrant, and he said that he does want to apply for full Medicaid. So we're going to go ahead and look at the application. If this was a live session, I would give you a little bit of time to fill out the application, but since it's a recording, we're going to go ahead and fill it out. But this is the information that you would use to fill out the PE application. So you have your application date, which was January 31st, 2021. Mr. Mapp information is going to go in this applicant information up here because he was the one applying. So we put his name, the address, city, state, zip code, county of residence. We put his telephone number, and he did not give his social security number, so that's okay. Now, when we screened the individuals, they were not known to GAMIS, so therefore, when you put them in GAMIS, then the system will create an ID number for all of them. So I just picked the number. Let's just say since everybody was approved, you're just going to put the number for at least one of the individuals. So in this case, let's just say we just put the number for any one of these individuals. And remember, this number is 12 digits long. So remember, make sure when you're writing this number that it is correct and it is associated with one of the people that were approved for presumptive, and that it is 12 digits long. No one had health insurance, and no one was in foster care. They were filing taxes. The wife and the husband was filing taxes jointly and claiming everybody. So that means that they're considered a tax filer household. So that's why I darkened in the circle for yes for tax filer household. Mr. Mapp's information goes on line 1. And then nobody is pregnant, so the rest of the people are going to go on the remaining lines. So I put Mrs. Page on line 2 with her income. For the type, I just put W. For the amount is $1,050. The frequency is monthly, so the monthly amount is still the same as $1,050. For the deduction, she had that pre-tax, that dental insurance. Remember, we had to convert that $60 to a monthly amount, and once we multiplied it out by that 4.3333, we got $259.99. So that's what goes right here in your pre-tax field. And remember, if they have pre-tax or 1040 deduction, you subtract that from the monthly amount. And once we subtracted that, the income comes out to be $790.01. So that goes on Mrs. Hayline. The next person I put on here was the oldest child, Teal. Then I put Chip. And then on the next page, I put Allie. And remember, I put Mr. Hay name up here and then also the ID number of the person that I put online on the previous page. Down here, subtotal net, everything that's in this column right here, which is only Mrs. Hayes' income. So that's $790.01. There were 5 people in the budget group. The income we looked at was the parent caretaker income limit, which is $752. We did have to subtract the 5% deduction in order to make them eligible. So we're going to put $130, and that's the amount that came off of our income limit chart based off of how many people are in the budget group. So now we subtract that $130 from this $790.01, and their income is $660.01. We compare that amount to the $752 to see that they are now eligible. So you're going to check eligible, and they're eligible for parent caretaker. Everybody's eligible for parent caretaker. Mr. Hay did want to apply for full Medicaid, so you check the box for yes. I put my information down here along with my signature. And remember, this application was done over the phone. So if this application was done over the phone, then we do the attachment A. We will read these statements verbatim to Mr. Hay. We read this question to him. He gave his verbal consent, so we said yes. We checked the box where it says sign on behalf of, print his name, date it, print your name, and then you sign it. And this can be electronically signed, the attachment A as well as the 632H. It can be electronically signed. So this is the PE application. So this is a correct PE application. And this application was done over the phone, so that's why this is blank. But you will still read this sworn statement out to your applicant. Okay, so if you have to stop this and, have more time to fill it out, go ahead and do that. And that's your attachment A because we did this particular application over the phone. Okay, example 2, we have Sandham. She comes to your hospital and wants to apply for PE. So this is the application that you're doing with the applicant there with you. She's pregnant with twins due September 2nd, 2021. She works 36 hours per week, earns $17.50 per hour. She's paid every week. She has $15 per week taken out of her check for health insurance. So she has other health insurance taken out of her check for $15 per week taken out of her check for health insurance. She does intend to file taxes, so she will file taxes. So she's applying for medical assistance. So let's go through our step-by-step process. We screen Ms. Ham and Gamis, and this time it shows us that she's active. And she's active with this ID number that we're going to write down and use. And she's active. What A category she's active up under? She's active up under P4HB 181. So that means we can go ahead with the PE process, but then we will need to do an extra step in completing the update form to send to DCH because we need to let them know that that this P4HB case needs to be terminated. So you're going to complete your 632H and all other required forms, and you're going to make an eligibility determination to see if she's eligible or not. And then if eligible, what A category, and then also enter that PE into Gamis. And then complete that PE manual update form that we looked at earlier. And remember, you're sending that along with the 632H. Now you don't have to do the attachment A because this application is not done over the phone. This situation, you're going to be providing her with that notice of action, the 634H, the temporary certificate, the understanding medical assistance booklet, the quick guide, the notice of ADA, and the P4HB information. Inform her of her PE period time and that her full application will be sent to DFAX for processing, and that you send your PE packet to DCH within 5 business days. So that is your step-by-step process for this particular example. So let's look at the budget group. She is intended to file taxes, so that means she's considered a tax filer household, And then her budget group should be her and her twins, because those are the only people that were in her particular example. So it should be a budget group of 3. Now let's look at her income. She's working, paid $17.50 an hour. She works 36 hours a week. So we're going to multiply $17.50 times 36, and that gives us an amount of $630. So on your P application, in that income field on her line, so in the amount field, this is what you're going to put. You're going to put this $630. You're not going to put $17.50. That's because you can't put the hours. So you're going to go ahead and multiply it out and put this amount up under the amount field. So now we need to take that amount and convert it over to a monthly amount. So she's paid every week. So we will multiply by 4.3333. And her income, her monthly amount comes out to be $2,729.97. But remember, she was paying health insurance $15 a week. So we need to convert that over to a monthly amount. So you multiply 15 times 4.3333, and you get $64.99. So that's what we would subtract that health insurance from her income. And her income is now $2,664.98. We compare that to the income limit for a budget group of 3. For a pregnant woman, the income limit is $4,026. So that means she's under that limit. So we do not need to subtract that 5% deduction. Next is the application information, the application date. That's her information along with her address and county, the phone number. She's expecting 2. Estimated due date is September 2nd, 2021. This is her ID number. It's 1 with 11 zeros. And then she is a U.S. citizen because she was born in Miami, Florida. So we're ready to go ahead and fill out this application. Application date is March 1st, 2021. We did have her ID number, so we go ahead and write that down. And then we fill in her demographic information, her name, address, city, state, zip code, county of residence, and telephone number. She did not give us her social security number. She does have other health insurance, so I'm going to darken in yes. And remember also that DMA 285 needs to be completed. And then also, since this is through a job and she's pregnant, when she completes that 94A, that attachment A needs to be completed as well. She has not been in foster care. She is filing taxes, so she's considered a tax filer household right here. And then she goes on line 1. Her income is type, this time I put E for earned income. You could have used W, that's fine, doesn't matter. But in the amount field, remember I told you she was paid $17.50 an hour, working 36 hours a week. Go ahead and multiply that out, and then you put that amount here. So when we multiply that out, we got $630. So that's what goes right here in the amount field. Paid every week, and then the monthly amount, once we converted that amount over, it gave us $2,729.97. She had that pre-tax deduction that she was paying for when we converted that $15 over that she was paying for every week. It gave us $64.99. That what goes in the pre-tax field. So we're going to subtract that pre-tax from the monthly amount, and her income is $2,664.98. So that goes in your monthly net income field. Her pregnancy information is on line 2. She's pregnant with 2. Due September 2nd, 2021, and then her name still goes right here on this line. There's nobody else to add on this application, so we'll go down here to where it says subtotal net income. It's everything in this column right here, so it's $2,664.98. Number in the budget group is 3 because it's her plus the 2 twins, plus the twins. The income limit for a budget group of 3 for pregnant women is $4,026. We do not have to subtract the 5% deduction, so that field will be left blank, and your total net income is still $2,664.98. She is eligible, and she's eligible for pregnant women, and she has to complete the 94A, so we're always going to check yes here. You're going to put your information down here along with your signature. Need to read this one statement out to your applicant, or either give them the paper and let them read it. And then she would date it and sign it because she's there with you at the office. Next step we need to do, remember we screened her and it shows that she was active up under P4HB, which is your planning for healthy baby. So we need to let DCH know to terminate that P4HB case. So the next form we need to complete is the PE manual update form. So you're going to put the date, and that was March 1st. Always check the middle box that says hospital PE. And the only thing we need to let DCH know is to terminate the P4HB. So you're going to check this box where it says terminate P4HB, print your name and your telephone number. Send this form along with the application, along with this application that we just did. Send this in a separate email. Your subject line is going to be PE manual update. And then on a second email, you're going to send your whole PE packet with everything, that checklist that we went over with everything in it. Send that as a separate email. So that is the application that you do in the office, and if somebody is active on P4HB. Okay, now next example, we have Mercedes Harry, 40, lives with her child Bam, who's 5. Mercedes is self-employed and earns $1,500 per month. Miss Harry is not expected to file taxes, so she's not expected to file taxes, and I should have said she's not expected to be claimed as a tax dependent. So that means she's going to be considered a non-tax filer household. They have no other health insurance, and no one has been in foster care. She's applying for medical assistance. Again, this is in the office with you. So the step-by-step process for her, we're going to screen both her and her child in gametes. When we screen, it says both of them are inactive, but it gave us their ID number. So that means that they've been on Medicaid before, they're just not active right now. So we're going to go ahead and write both of these numbers down because we're going to see which one we're going to put on the particular PE application. You're going to start your interview process to complete the 632H and other forms. Determine if they're going to be eligible or ineligible. If they are, what aid category, and then enter the PE into gametes if that particular individual was eligible. You're going to provide her with the notice of action, the temporary certificate for each person that was approved, the understanding medical assistance booklet, the quick guide, the notice of ADA, and the P4HB information. Inform her of her PE period time and to send the PE packet to DCH within 5 business days. So for her budget group, she is a non-tax filer budget group. So in her household should be her spouse if living together, any children under the age of 19 if living together, and unborn fetus. So in this situation, it's just her and her child. So it should be a budget group of 2. She's self-employed and she earns $1,500 a month. So that is the total income is $1,500. She has no pre-tax or 1040 deduction, so there's nothing we need to subtract. So her income is $1,500. This is the application information. She applied on March 27. That's her name, address, her name, date of birth, address, county, phone number. This is her child's information. And we're going to put his number on here because we're going to see that he's going to be the only one eligible. Both of them are U.S. citizens, so they meet the U.S. citizen criteria. And Miss Harry, you're going to ask her if she wants to apply for full Medicaid, and she said no, so she doesn't want to apply for full Medicaid. So let's look at the application for her. The application date is 3/27. We're going to put the ID number for Bam because he's going to be the only one eligible. We're going to put her name with her address, city, state, zip code, county of residence, and phone number. She didn't give us the social security number. They didn't have other health insurance, and no one was in foster care. This time, she does not intend to file taxes or be claimed as a tax dependent. So this time, she's considered a non-tax filer household. For number 1, she goes on line 1. Her income is S or SE for self-employment. The amount is $1,500. The frequency is M for monthly, and the monthly amount is still $1,500. There's no pre-tax or 1040 deduction, so the monthly net income is still $1,500. She is not pregnant, and then her child goes on line 3. Subtotal net income is still $1,500 because that's the only income in this column. The number in the budget group is 2, her and her child. And the poverty income level, I put 457, so this is the income limit for parent caretaker because we're trying to look at the PE Medicaid for both of them. So to look at PE Medicaid for both of them, we have to look at parent caretaker first. So they have to meet all of the eligibility criteria. So they met all the eligibility criteria except for the income. Because if you look at her income is $1,500. Compare that to the 457, she's over. Even if we did subtract the 5% deduction, she still would be over. So that means that nobody is eligible for parent caretaker because they're over the income limit. They met all the other criteria, but they did not meet the income criteria. So that means nobody's eligible for parent caretaker. So Mercedes is not eligible for presumptive. So you would give her a denial notice. But we still have other aid categories that we can look at the child for. We could look at the child for children under 19 because he's only 5. So we look at the income limit for a budget group of 2 for a 5-year-old is $2,163. We compare that to the income, her income, which is $1,500. That means that that child is eligible, but it's eligible for children under 19. The child is not eligible for parent caretaker with children because the mom wasn't eligible. So the child has to be eligible for children under 19. So in that case, 5% deduction, we could have used it with the 457, but she still would have been over. So I really wouldn't use it. Now, if the income was over for the child, we would use the 5% deduction. The total net income is still $1,500. At least one person in this household was eligible. So you're going to check eligible. And you're going to check children under 19. She said she did not want to apply for full Medicaid, so you're going to check the box for no, and she needs to initial right here. Remember, you need to put your information down here with your signature. Excuse me. Read this sworn statement to Mercedes, and she needs to sign it and date it. And we do not have to do a PE manual update form because nothing needs to be updated. We're going to put them in the right aid category. And she doesn't have planning for healthy babies, or he doesn't have planning for healthy babies. So we don't need to fill out the PE manual update form. And then this application is done in the office with you, so we don't have to do the attachment A. So those are the 3 examples that I've given you that you can refer back to make sure that you are completing your applications correct, because like I said, that will be part of your performance standards or part of the audit process. So once you have done your forms and once you've made a determination on the 632H that individuals have been approved, then you're ready to enter that information on the GAMIS web portal. Remember, I was telling you, once you have entered them into GAMIS, it will give you an opportunity to print out a temporary certificate. You need to make sure that you are printing that out. So you're going to give them a copy of it. And then you're just going to email your PE packet to DCH within 5 business days. You do not have to include the temporary certificate as part of the PE packet, only the notice of action, the 634H. So when you enter this information to GAMIS, if an individual was denied, you can enter that denied person into GAMIS, but they have to have been in the household with at least one person that did qualify, because you're going to have to put the person that was eligible, you're going to have to put that person in first before you're able to put the denial person into GAMIS. And for the denial person, you're going to give them the 634H. And once you see, you will have the opportunity, if you're able to put them into GAMIS, to print them out a certificate of denial. So if you want to print that out and give that to them, you can do that as well. So remember, these are our 8 categories that we looked at. So you have your parent caretaker. For the parent caretaker, there are 2 8 categories. There's an 801 and there's an 802. So that means if a household was eligible for parent caretaker, they're all going to go in that A category, but you're going to put the adults in the 801 for the presumptive parent caretaker adult Medicaid, and then you're going to put the children in 802, which is the presumptive parent caretaker child Medicaid. So they're both in parent caretaker, but one is just for the adult and one is for the children. And then your children under 19 is 806, the form of foster care is 852, and your presumptive women is 864. So now we're going to look at the screenshots of how to screen an individual in gametes, and then how to enter that approval into gametes, and also the denied person if you can. So once you go to the mmis.georgia.gov web address, you will need to make sure that you sign in with your credentials. If you don't have sign-in credentials yet, once you have passed your assessment and completed all of your paperwork, your PE coordinator will need to make sure to request that information for you, whether it's your PE coordinator or either the administrator that request access, gametes access. So that will have to be requested from your particular hospital. So once you have logged into it, you're going to go to eligibility, and this is how we're going to screen the individual. So you're going to either have their ID number already if they have it, or you can screen by their name and date of birth, or you can screen by their social security number. Once you put in the information that you have, you make sure that you put in a from and through date of service, and you're going to click search. Once you click search, then if they were known to the system, their member ID information is going to populate right here. So whatever information that we last had for them, that's what's going to populate here. So if they have an ID number, it will show right here. And that's the number you would need to write down. Down here, it will give you if they are active or not. So if there's status, you're going to look for status, and it'll show you whether it's active or inactive. If it's active, then you need to come over here to where it says A category to determine what A category they're active up under. Because we went over earlier, based off of the A category, whether you will do a PE application or not, or whether you need to follow another different type of procedure. So after you screen them, then you go ahead and do your 632H during your interview process to, complete everything. And then you're going to determine if they meet all the eligibility criteria. If they do, then you're going to approve them and what A category you're approving them for. Once you have done all of that, the individual has signed everything, then you're ready to put those approval people into gametes. So what you're going to do is to go back into the home page, and you're going to click presumptive activations. Once you click on presumptive activations, you're going to click on hospital activations. Now, if you're doing a pregnant woman, then you will click pregnant woman activations, but everybody else will go up on the hospital activations. So if you have to do a pregnant woman, make sure you do pregnant woman activations. Okay, if they have the, once you click on hospital activations, if they have an ID number already known, go ahead and enter it in and hit enter. And once you do that, it's going to pre-populate the last information that we have for them. So this is what it's showing you, the last information that we have for them. So once you see that the information that we have, you're ready to go in and update any information that you need to. But if they don't have an ID number in, you just go ahead and start filling out these fields based off what you have on that 632H. So the taxable income would be that total net income field. So whatever's in that field, that's the amount you put here for each individual person that you're adding. How many adults and how many children. And then down here is their demographic information. Like I said, on some of this, you will be able to update, and some you will not be able to update it. So if you're able to update it and it needs to be updated, go ahead and update it here, because once you hit submit, you're not going to be able to update it. And that's when you will have to fill out that PE manual update form. Down here is going to ask you if a Medicaid application was submitted. This should always be yes, because that 632H should always be completed. If anybody is pregnant, you're going to indicate that here, and if they are, you're going to indicate the number of births and then the due date. The application date should be entered right here, so it should be that same day that you approve them. So if you approve them on March 1st, then March 1st date should be right here. And that date will be correlating with this determination eligibility begin date, which is stamp date by the computer. So those two dates should be the same. And then you're going to click on the drop down menu next to the field that says aid category to choose what aid category they should be in. Once you have entered that information, make sure you go back to review everything to make sure that it is correct. If you reviewed it and it is correct, you're going to go ahead and click submit. Once you click submit, it's going to give you the opportunity to get the ID number. If they were not known, if they've not been known to the system, don't have an ID number, remember I told you once you enter it in, Gametes will populate them ID number, so it will populate right here. And then their temporary certificate, you're going to click on this hyperlink that says certificate of eligibility. Click on that, and that's when another window will pop up, and you would just print that certificate out for them. And that certificate is good because it has the pharmacy bin number on there that is needed for their prescriptions to be filled. So that's all you have to do to add a person. Either if they already have an ID number, you will put it in to pre-populate their information. If they don't, you just go ahead and start filling in the fields based off of the information on the 632H. And so if you have other people that you need to add, you're just going to follow that same process. And remember, I told you earlier, if a person is trying to apply for a presumptive, again, they're not pregnant, but they're in another aid category, they were already approved, and it has been within 2 years. Remember, I told you how to go through the whole process to determine if they're eligible or not. Then if they are, you would try to, put them into Gametes. And then once you put them in, if they had presumptive within the last 2 years, then this is the error message that you would get, and you would not be able to go any further. And I think down here, it would tell you what their application date was that they, applied for. So if you have to add, once you've added one person, you will go back through the same process to add the other individual. So that is what the next few slides are showing. They're showing you the same information that we just went over, how to add the other people. So it's just the same process of entering their information from the 632H, clicking on what aid category they should be approved for, and reviewing that information to make sure that it is correct. And once you reviewed it, you're going to hit submit. And then it will come up with the ID number if the system generated them one, and then their certificate of eligibility. So that's for every person that you're adding. You're just going to go through the same process. You're just doing it for a different person, but it's the same process. If an individual was denied, remember, in order to add them, you first have to add the people that were approved first. So the steps that we just went over, you'll follow those same steps to add the approval people first. So if they have the ID number, put the ID number in so it can pre-populate the last information. If it doesn't, go ahead and start filling this information out. And then you're going to pick the aid category that particular person is supposed to be in. Once you click the aid category that's the person is supposed to be in, review that information and hit submit. And then again, of course, that's their ID number if it was, done by the system, and then the certificate of eligibility. And then once you've done that, you're ready to put the denial person in. So even though they were denied, if they already still have an ID number, you're going to go ahead and put that ID number in and hit enter, and you're going to fill in this information for them down here. So once you fill in all their information from the 632H, instead of picking the A category, you're going to pick the denial reason, and you're going to choose one of those 7 reasons why they were denied. So instead of doing the A category, the only difference is you're going to be picking the denial reason. Once you put the denial reason, you're going to click submit, And then right here, this is where I was telling you about the certificate of denial. So if you want to click on that and print that out for them, you can do that. But they will always get that notice of action at 634H. So that is how you screen an individual. That is how you add individuals that were approved, and then also for any denial people that you want to put into the system. Now we're going to go over our performance standards. So how do we do the performance standards? So for each hospital that does application, DCH does a monthly report that is pulled from GAMIS to show how many individuals that you added to GAMIS and up under what aid category did you add them up under. So just be careful when you're entering this information to GAMIS. It captures everything. It captures everybody that you added to PE and what aid category that you added them to, what date, their name, their all their demographic information. So it tells us all of that. So we do a monthly report to determine that. Then once the monthly report is done, what we would do is based off of how many people that you added to presumptive for that particular month, we would take 10% of that total amount. So if you've done 20 people for that month, then we're going to look at 2 applications for you for that month. If you only done 5 people that month, then we're only going to really look at 1 application for you for that particular month. So you might not have a lot of applications that we audit. So if we don't, that means really your application, well, everybody's application should be, try to be completed at 100%. But, of course, people make mistakes, and especially if you're coming on brand new to this, you're going to need some time to get used to it. But if you know that your hospital really doesn't do many applications, that means there's really no room for error, but you will have some coaching and training times. But the particular hospital will have to still meet that accuracy rate of 90%. And that is for everybody right now. And that stands for the end of the year. So we take the accuracy rate, even though you get an accuracy rate each month, because we audit application each month if you completed applications, we send you the accuracy rate for each month, but we really just look at their performance, based off of that whole year, and that's when you will have to meet that 90%. So this is the audit form that I do, and this is what I audit for each month if your hospital did applications for that particular month. If your hospitals did not do applications for that particular month, or either you did an application, but those applications the applicant did not apply for full Medicaid, we're not going to audit that application. We're only auditing applications that have a full Medicaid attached to it. So if the applicant did not apply for full Medicaid, that application will not be audited. Or either if you didn't do audit applications that month, then of course you won't have a audit for that particular month. So this is what the audit form looks like that is emailed to the P coordinators each month. So they should be sharing this information with you, especially if you were the one that was audited for that month. You would need to know if you made any errors, and if so, you need to review those errors just to make sure that you understand what you did incorrectly so you can correct them going forward. So the 8 areas that I'm looking at are the P application, looking at the budget group, making sure everybody's a U.S. citizen or meet the immigration status, they are Georgia resident, you calculated the income and deductions correctly, you approved them for the right aid category, you put the information into GAMIS correctly, and then also you have all your necessary forms, meaning that you have everything that you need for your PE packet. So if there's anything missing off of one of these 8 areas, that's where your error will be counted off. For example, for the missing fields on the PE application, if you have more than one field that was missing or incorrect, it's only going to be counted one time. So you're not going to see anything counted more than one time in these fields, okay? So it's only going to be counted one time. And then over here, the last, this column, excuse me, this column right here will be the initials of the staff that did that particular application. If you have any errors Then over here in the comments field, I will be a little bit more specific of what that error was. And then once we put the number of applications that we audited for that month, then it will get your accuracy rate based off of the number of applications and the number of errors that you made. So again, this is the audit form that is sent to your PE coordinators each month for your particular hospital if they did applications. So this is the fields that I just went over. So your references to use, if you need to give the DFACS local office information to your member, you can go to this web address to get that. But instead, I would just give them the web address to Gateway and to the DFACS call center. And that's because right now, you know, everybody's still working from home. So these are really their only two options, to go to the Gateway web address or either call the 1-877 number. This is the web address to the GAMIS web portal. This is where you're going to be entering the PE into GAMIS. This is also where you can download the forms that we went over, and also where you can find a copy of the hospital presumptive eligibility manual. And this manual is updated every quarter. All the forms should be located on that GAMIS web portal, except for the notice of ADA. That is not, so you're going to have to continue just to print off of that, and the P4HB information. So you're going to have to continue to print off of the one that I provided to you. And then the 94A is not listed on the GAMIS web portal. Those can be ordered through DFACS, or either you can continue to print off of the ones that I gave you. But if you need the ones from DFACS, if you need to order the ones from DFACS, please send me an email to let me know, and I will provide you with the person you will need to reach out to order those. And then I told you earlier of how to order the Understanding Medical Assistance booklet. If an individual is ineligible once DFACS makes a determination, then their application, or they will be referred to the Federal Facilitated Marketplace to apply with healthcare.gov. The information that you received today is all policy and eligibility information. If for some reason you are having issues with your claims or with billing, then you would need to make sure to reach out to the provider contact center at Gainwell Technologies, and someone will be able to help you with that, because I can't really help you with billing and claiming issues. I can only help you with the policy part of it and the eligibility part of it. So anything outside of that would have to be, you know, discussed with the provider contact center. And this is their phone number. And then if you just want to fill out the web feature, you can on their web address, where you will fill out a form and somebody should contact you back. Okay. So if you are a veteran worker and you reviewed this training, just make sure that this is everything that you would need to know. So just make sure if you have any questions that you did, write them down. And once you have those written down, you can send that back to your PE coordinator, or either you can go ahead and just send me a copy of that. You don't have to do a sign-in sheet or anything like that. So you could just send me back your questions so I can respond back to them. But for new, excuse me, for new employees that are reviewing this training for the first time, remember I told you you will have an assessment that you will have to take and pass with the 80% or higher. So this is how you would need, this is what the instruction that you would need to do in order to get your assessment. So once you have completed this training, you need to send me an email and let me know that you have, you know, completed the training, and I will reply back to you with your assessment. Okay. Once I reply back to you with your assessment, then you're able to go ahead and start your assessment. This is now, keep forgetting, this is a recorded training, so I had to update that. So you just send me an email stating that you have completed reviewing the training, and I'll reply back to you with your assessment. Then Once you do that, you will need to complete the sign-in sheet that was provided to you in your training material email. Remember, you need to complete the provider agreement that I went over earlier, and your PE coordinator will also need to sign off on it. You need to complete your assessment. Once you have all three of these completed in its entirety, then you will need to give it to your PE coordinator, or either you can send me back everything. Do not send me one piece of information without the other. Don't send me 3 emails. Don't send me 2 emails. Send me one email with all 3 attached. One email with your sign-in sheet, with your provider agreement, and with your assessment. Send me one email with all 3 of these attached. So you can send it to me, as soon as you complete the training and have everything completed. Once you have everything completed, go ahead and send that to me. I will grade your assessment and send you back your results. Also, if you have any questions, please make sure that you send them as well. If you need to contact me for anything, I first highly recommend that you reach out to your PE coordinators if you have any questions about anything, especially when you start doing applications. If you have any questions about, a scenario that you're presented with, you need to try to reach out to your PE coordinator first. If they are unable, then they will reach out to me. If they're unable to, provide you with a response, then they will reach out to me to get a response, or either if they're not available, you can reach out to me and I'll try to help you with it. So try to contact me via email first if you can, and then you can try to contact me via phone. So this is my information. This is for your records only. Please do not give out my contact information to anybody, not to other hospital workers, not to applicants or other members. Don't give out my information. If you're having a situation with a member or something, you can contact me first to let me know what the situation is. We can talk about it, and then we can, I'll tell you what the next steps will be. Either I can reach out to the member, or I will let you know that, you can give the member to me. Okay, so that's my contact information. And like I said, if you had any questions, please make sure you have wrote down all of your questions in the document that was provided to you, which is the Hospital Presumptive Eligibility Training Questions document. Write your questions down, and when you send me, you can send your questions back with the email, especially if you're a new employee. When you send me an email stating that you have completed reviewing the training, go ahead and send me your questions at that time, so that way I can respond back to you and you can have the responses back before you do your assessment, because I know you will probably need your questions answered before you try the assessment. So for new employees, again, when you're sending me the email letting me know that you have completed reviewing the training, send me a copy of your questions as well. So that way, when I send you your assessment, I can send you back the answers to the questions. So this was the training for the Hospital Presumptive Eligibility Program. I hope you enjoyed reviewing this training. I hope you got everything that you need. But if you need further verification or clarification or have questions, please make sure you provide those questions to me so I can get a response back to you. So again, if you need anything, please feel free to reach out to me. Thank you for reviewing this training, and I hope you have a great rest of the day.